So good day, ladies and gentlemen. It is the third day of our conference or webinar. My thanks to those of you who have stayed with us over the last 2 days. Today will be equally interesting. We normally start at 5 minutes past the hour, just so that a few latecomers can join us. And yesterday also, what I did was to try and give my impressions of what happened the day before. So for those of you who were here yesterday, I thought the first session captured the whole idea of systems views on this problem. Professor Malik Piris talked about a one health system that involved humans, animals, and the environment. And then, of course, Professor Ann Mills also talked about the health system and the way that it had been impacted by COVID, and her own views about the way that it would develop in the future. The other thing that I thought came out yesterday was the whole idea of communities and the way that different communities were impacted, and you know, the way that that would play out in the future also. So we had communities based on gender, then ethnic communities, immigrant communities in Canada, actually, internally displaced communities in Sri Lanka, and I think Emma Tomalin talked about religious communities. So these are my own impressions. I don't know whether anybody else wants to share their impressions. I see Tudor is on the call. I did not give him any any notice, but I don't know whether Tudor, you want to share anything about your thoughts regarding what happened yesterday, and you know, your views about the general themes and trends that we observe.
Thank you, Priyan. I think you captured it pretty well. The one issue that came up in relation to religion is, you know, the different roles of religion. Religion as sometimes a trigger for social tension and misunderstanding. At the same time, religion as an asset that helps people to respond to the pandemic in a satisfactory manner. So that point came out pretty well. But otherwise, I think what you presented was quite clear.
And I think on day one, I think I thought there was a lot of emphasis on the equity issue, the inequities that are associated with this problem, right? I mean, we saw it in the first keynote speaker, Professor Abrams, and various other speakers also. Sometimes, you know, measures to reduce that inequity, like social protection measures and things like that. I'm sure Jim will say some things about inequity with regard to education going into the future as well, but we will listen to him when the time comes. Yes. All right, so we are going to start the day with a message from Ms. Hannah Singha-Hamdi, who is the United Nations Resident Coordinator in Sri Lanka and leads the UN country team of 22 resident and non-resident UN agencies. Prior to Sri Lanka, Ms. Singha-Hamdi held several senior leadership positions in UNICEF across the world, including being the Associate Regional Director of UNICEF Geneva and country representative for UNICEF Syria, Nepal, Kazakhstan, and Azerbaijan. Ms. Singha-Hamdi holds a master's degree in political sociology and a bachelor's degree in political science from the American University in Cairo, Egypt. She is the author and co-author of 2 publications on social change in the Middle East. I must also thank the UN system for publicizing our seminar. So it is very nice to have you with us this afternoon, and we are looking forward to your message to us.
Thank you, Professor Dias. Thank you very much. I'm actually still recovering from COVID myself, so but just because I have so much respect to the academia and science, I have agreed to really share some ideas with you. But what a great honor to address you all today. I'm really humbled, and thanks for inviting me for that. I miss my academic years. Actually, I did have a few years, 6 or 7 years of being an academician myself. So it's always good to be part of this distinguished group. So, colleagues. Science, of course. I think the title of my words today is about the role of science in fighting the infodemic. So now, science represents the world's best chance for recovering better from the COVID-19 crisis. Now, as societies face the difficult tasks of implementing recovery strategies with limited time and resources, they have a choice between either business as usual and the transformative changes. Now, transformation offers better prospects, but it will also require ingenuity and research from a full range of disciplines. The UN research roadmap for the COVID-19 recovery, which many of you have seen, provides a roadmap, a framework for leveraging the science, the power of science in support of a better socioeconomic recovery and a more equitable, resilient, and sustainable future. Now, so what does this mean? So this afternoon, I would like to speak to you on one area contained in the roadmap, which will provide you with some concrete and actionable steps, or perhaps can provide some concrete and actionable steps in our future work. Specifically, I want to focus on the role of science in fighting infodemic, linked to Pillar 5 of our research priorities, which I know you are very familiar with, and on social cohesion and community resilience and the spread of misinformation. As noted in the research roadmap, reliance on digital technology can have varying social impacts, ranging from facilitating social, employment, and educational connections to enabling, and what we saw, harassment, creating surveillance and privacy issues, and undermining democracy and self-determinations through the spread of misinformation. Now, the COVID-19 pandemic is the first in the social media era, and people around the world have turned to social media platforms for news and for information. So in light of this trend, research to help combat the digital spread of hatred, xenophobia, and misinformation will then be particularly critical. So as scientists and academics covering such a vast field of disciplines, your work helps save lives and make the world a safer place to live. Therefore, your role in fighting the infodemic brought upon us by the COVID-19 pandemic has been immense. First, let me start by defining what I mean by when I say infodemic. According to WHO, an infodemic is too much information, including false or misleading information on digital and physical environments during a disease outbreak. In such situations, misinformation and rumors appears on the scene along with the manipulation of information and doubtful intent. In the information age, this phenomenon is amplified through social network, spreading faster and further like a virus. We can all agree that the internet has altered our society as profoundly as the printing press, requiring a deep reimagining of the ethics and the mindsets with which we approach knowledge, communication, and cohesion. So along with the potential for more accessible information and rapid communication and consultation, the digital age, specifically social media, has also heightened the fragmentation and the mistrust. So the ability to cause large-scale disinformation and undermine scientifically established facts is an existential risk to humanity. So why should you as the academic community care about the infodemic, what that is spreading like wildfire? The Pan-American Health Organization and the WHO notes that the infodemic and the spread of misinformation is making the pandemic worse. This is because it makes it very difficult for people, for everyday people, to find trustworthy sources and reliable guidance on what they need. They feel anxiety, of course. This causes, of course, anxiety, a bit of a feel of overwhelm, emotionally drained, and the inability to meet important decision-making demands. The infodemic also causes confusion and risk-taking behavior that can definitely, and you're all aware, of course, can cause actually harm to the health. It also leads to mistrust in health authorities and undermines the public health response. Therefore, an infodemic can intensify or lengthen outbreaks when people are unsure about what they need to do to protect their health and the health of the people around them. Now, for this reason, the UN has been focusing our efforts on fighting the infodemic and the flood of online misinformation since the onset of the pandemic, while vigorously defending the right, of course, of freedom of expression everywhere. We are also encouraging countries to develop a common, empirically backed consensus on the public good of facts, science, and knowledge. So even prior to misinformation that circulated during the pandemic, the United Nations had strong models of science and empirical evidence-backed approaches to inform policy, such as the Intergovernmental Panel on Climate Change and the World Meteorological Organization Scientific Advisory Panel. Furthermore, we have been champions for public interest and independent media, regulations of social media, strengthening freedom of information or right to information laws, and ensuring a prominent voice for science and expertise, for example, through the representation of science commissions in decision-making. Now, from the onset of the pandemic, WHO had established the information network for epidemics that unites technical and social media teams, working closely on track to respond to misinformation, myths, and rumors, and provide tailored information and evidence for action. Examples of this work around the world has been quite a bit, but in our case in Sri Lanka, for example, the UN immediately partnered with the Ministry of Health Promotion Bureau through the Health Promotion Bureau and other entities such as fact-checking organization to tackle rumors and misinformation as soon as they started gaining virally online. For example, regarding the supposedly home remedies against COVID-19, erroneous or misleading information on ways to catch it or avoid it, singling out specific communities as spreaders of the virus. All these were among some of the issues that the UN in Sri Lanka, for example, focused on together with the Ministry of Health on fighting these misinformation. So a key approach in this regard was making the verified scientific-based information available in the Sri Lankan languages, helping to raise awareness among various communities across the island. So what now? So now we see clearly from this pandemic that science and academia have a profound role to play in ensuring that we see an end to this pandemic and we recover better from the devastation it has caused to our communities. So let me leave you with 3 areas where you play an important role. First, the role of scientists. Insights from the welcome Global Monitor in November 2021, which is the largest global survey of how people think and feel about science, found that levels of trust in scientists had increased in 2020 in comparison to 2018. So the COVID-19 pandemic had actually, interestingly, thrust scientists into the spotlight where they had provided information and guidance affecting the day-to-day lives of billions of people. Therefore, their role in producing and disseminating empirical evidence that fights misinformation is vital to fighting our current infodemic. The second point is the role of social sciences. The social sciences also have an urgent role to play in ensuring that the voices of communities affected by an issue are represented in discussions of it, and that relevant stakeholders are able to be involved in decisions that affect them. So at a recent article from the London School of Economics puts it, there is no point devising lockdowns when nobody will follow, or developing a vaccine that nobody will take. So social scientists can help policymakers and STEM colleagues develop solutions that people are able, and more importantly, willing, or encourage people to be willing to follow through. Third point is building back better. So a recent report by the Center of Economic Performance and the Grantham Research Institute on Climate Change and Environment notes that a better post-recovery world will undoubtedly also benefit from a well-documented contributions that social science makes in the areas such as improving the resilience of our democracies and financial systems, exposing and addressing social and economic inequalities, and promoting good mental health and more sustainable ways of living. Therefore, you see, my dear colleagues, there is truly a great deal of work. We need you to contribute to fighting the infodemic, both from the perspective of the natural science and the social science. And as always, the United Nations globally, and in Sri Lanka, of course, will always be your partners in combating misinformation and promoting your work to help us all recover better. Thank you very much.
Thank you very much for those challenges. Very interesting. I think a lot of our thinking actually resonates with what you were saying, but you brought it sharply into focus. Thank you very much for joining us.
Thank you.
At this stage, I want to introduce our session chairperson. Dr. Ranjit Mahindapala was the director of the Coconut Research Institute of Sri Lanka from 1987 to 1993. He was then appointed as the executive director of the Sri Lanka Council for Agricultural Research Policy. Subsequently, he worked at the International Union for the Conservation of Nature, more commonly known as IUCN, both in Colombo and Bangkok. He is also an independent evaluator associated with the community of evaluators in South Asia. He is the immediate past president of the National Academy of Sciences of Sri Lanka, and he's the person the Academy always turns to for his wisdom. So over to you, Dr. Mahindapala. Over to you, Ranjit, to conduct the next session.
Thank you very much, Priyan, for those kind words. And let me just briefly tell you that there's a slight change in the program. There's in fact an addition. We have keynote speech to begin with, and followed by lead paper. And we have also brought in a lead paper which could not be done yesterday due to technical difficulties, that of Dr. Melvin Jabba, and which will actually be presented at 3:30 this afternoon. So that's an additional to the agenda. So we have an additional paper. Let me, at this point in time, while saying good day to all of you, extend a very warm welcome to Dr. Jim Ackers. I'm very pleased to introduce Dr. Ackers, who is the Regional Education Advisor at the UNICEF Regional Office for South Asia, or what's called ROSA, in Kathmandu, where he provides oversight for education programs across 8 countries. Jim holds a PhD in education policy from the University of Newcastle upon Tyne in the United Kingdom. He has published extensively in many leading refereed journals. And of course, most recently, he was the co-editor of the publication Education Response to Covid-19 Pandemic, which was a special issue of the International Journal of Educational Development. Jim has been with UNICEF for 13 years, starting as the Chief of Education in Nairobi in 2003 to 2007. He currently covers areas ranging from early childhood education, primary and secondary education, and adolescent skills and employability, and of course disability issues, which is core of UNICEF. Recently, under his leadership, UNICEF South ROSA developed a regional strategy on technology for learning and a blog on the need for essential learning packages to address the risk of continued disruption in education in South Asia forward. As you know, UNICEF has contributed tremendously in the last 2 years on COVID-related issues, and I'm sure Jim will bring those perspectives to table today, which will enrich our discussion. And Jim, over to you, Jim, for your presentation.
Just getting my slides in order. Great. Okay. No, thank you very much, Dr. Mahandapala. And I think initially it was yourself who, suggested to me that I might join this this very interesting discussion around the long-term impact of COVID. And Professor Pia, to both of you, indeed, it's an honor to be asked to join this very important deliberation. I've actually been in UNICEF for 18 years. I probably gave you some misinformation there. And the interesting thing is that I actually retire from UNICEF next Monday. So this is actually my last presentation as a UNICEF staff member. So it's a real honor to be able to give it to the Sri Lanka Academy of Science. In fact, one of my last field visits was to Sri Lanka in January 2020, just before the pandemic really took off. And it was the first time I've been to Sri Lanka. I actually went into some schools and saw some really good pedagogy, it shows that we can be changing the way that we actually teach and so on. My title is Learning Transformation for All Post-COVID-19, which looks extremely positive in terms of intention. It suggests that, we're on the cusp of really transforming education because of what we've learned, perhaps from COVID. But I think you'll see during the presentation that we have a lot of really critical challenges in the short term, before we can really transform education into something which reaches everybody and is of higher quality. So let me move now to the actual outline of the presentation. I'll be looking at, first of all, at the overview of global impact of school closures, and then focusing on the impacts and responses to COVID-19 on education, remote learning challenges, the impact of school closures on learning, how we might mitigate learning loss, how countries can support recovery efforts, and then moving on to perhaps more of the agenda reflected in the title, what we can do to transform education to keep us on track for SDG 4 and indeed the SDGs more generally. And then finally, I'll be looking at what are the key questions that we need to be asking ourselves about education in future if we are really to take this, what some people say, once in a lifetime opportunity to transform education. So that's the menu essentially. I'll move on to the next slide. So this slide actually gives you a picture of the impact of COVID globally in terms of school closures. And what you can see at a glance is that in some countries, schools were actually between the period of February 2020 to January 2022, which is nearly 2 years. In some countries, schools were closed for as much as 41 weeks. Particularly if you look at Latin America, it's been a big issue there. In some parts of Africa, Middle East in particular. And then if you move down a little bit, where schools were closed between 31 and 40 weeks, then you start seeing the countries in our region, in South Asia. There's been a lot of school closures in South Asia. So that's the first slide in terms of the level of school closures over this period. The next slide is particularly looking at our own region, and it's a very concerning slide. If you look at red, essentially it means that schools were closed. If you look at yellow, it means that schools were partially open. And if you look at green, it means that schools were open. And this is over a period of 2 years. So of course, the country which is of most concern to us in the South Asia office has been Bangladesh, which was the schools were fully closed for a period of 18 months. If you look at Afghanistan, there's been closure, there's been partial reopening, there's been some full reopening, etc. If you look at Bhutan, there's been a good period from March 2021, and that's partly because Bhutan felt it could isolate itself from the spread of the pandemic. In terms of Sri Lanka itself, and I know this meeting is not just about Sri Lanka, but in terms of Sri Lanka, schools were fully closed for 50 weeks and partially closed for 23 weeks. Well, essentially, I think the message here is very worrying. It means that a lot of children have only been receiving a partial education or no face-to-face education for a very long period of time. And therefore, this is likely to have quite a significant impact on learning loss. Moving on to the next slide. So a lot of what I present today will actually be drawn from the situation analysis on the effects of and responses to COVID-19 on the education sector in Asia. Now, first of all, of course, you have the direct impact of COVID on education. The direct impact, I would say, would be the infection rates of students, the infection rates of teachers, etc. And then you have the indirect impacts. Now, of course, one of the indirect impacts has been the closure of schools. It has not been a necessary impact because global agencies such as WHO, UNICEF, and the UN bodies as a whole have urged countries to keep schools open and only close them as a last resort and to reopen them as soon as possible. But clearly that message has not really got through to policymakers. Maybe it's also not got through to teachers, and maybe it's also not got through to parents. So there's been a real communication challenge. And maybe again, it does relate to what the resident coordinator just described as the infodemic. There's been a lack of trust in official guidance and scientific guidance around school closures. So one of the in the initial days when schools were actually closing down, some people from different agencies, also governments, were actually quite excited about the potential of distance learning. They felt that it could actually be a more efficient, more up-to-date way of reaching children, etc. I think in some systems there was governments were struggling with maybe teacher management issues. Teachers are often quite poorly paid, motivation levels might be quite poor. So I think quite a few agencies and governments were quite excited about what might happen if we move towards distance education. And one of the big issues that we were trying to engage with as UNICEF and other agencies was trying to shift people's thinking a little bit away from just looking at COVID in terms of a health risk, and therefore closing all schools whenever, as a kind of knee-jerk reaction, and also to look at the other risk, which was the risk to learning if children were deprived of being able to go to school. So that was a kind of argument we were trying to put to the different countries in the region and globally. So there was a lot of creativity initially in the COVID response. A lot of governments started TV programs, radio programs, etc., to try and compensate for the fact that children were not able to go to school. But there were many challenges to this, to the effectiveness of this approach. And these, I think, are the basic reasons for the challenge. And the first one is the very limited access to digital devices, whether that's a computer or whether that's a smartphone, etc. And secondly, something a little bit less obvious, actual capacity to use digital devices. So they were both big issues. Inability to shift to digital learning in the case of parents who were supporting children's education at home, and also teachers. There's a real threat now that teachers can be left behind. Quite often students are more adept in terms of digital engagement than their own teachers. And then there's a quality of learning resources. Of course, you can always say we have distance learning now, this can transform your education. But if you've worked in the development of distance learning materials, you realize it takes a long time to develop high quality programs. As I said before, TV and radio have limited utility. They're not really interactive ways. You can build interaction around them, but by nature, they're not really interactive. You don't pause television broadcasts and ask children then to look at workbooks, etc. One of the very interesting things happening during the pandemic, though, was that people were not initially aware of the potential of mobile phones as a new media of learning. But of course, mobile phones in themselves are very limited because of the size of the screen, etc. But if combined with other forms, can be very powerful. And finally, there's the obvious challenge of the cost of devices and the lack of connectivity. So these are the challenges that we found through our research on remote learning in the region. And just to bring this down to the actual case now of Sri Lanka itself, where we did a case study on remote learning. And on the bottom axis there, you have the access rate. So access rate to TV, of course, is very high, about 90%. And then you've got the access rate to computers, which is very low, about 15%. So this has been one of the challenges, the actual access to these different media. But then what's very interesting on the left is we have the usage or utilization. So what's interesting here is that although access to basic phones and radio, TV is very high, they haven't actually been used very much by the learner. What has been used a lot in Sri Lanka, and I think Sri Lanka was one of the lead countries in this, is printed materials. A lot of countries were focusing too much on distance learning type materials, electronic devices, TV, etc., and neglecting what children can actually take home in their hands and actually read at home. Another interesting area that was a little bit neglected in the discourse was textbooks, which for me are an obvious resource for children if they're stuck at home. If a teacher can actually be interacting with them around the textbooks, they can continue learning. So that's the situation on the left in terms of the public schools. I think the other interesting thing here in the study in Sri Lanka is the contrast between private schools and study schools. Private schools and public schools. So if you look, for example, on the right of the graphic, on the right-hand graphic, smartphones were highly utilized were highly available, first of all, for children going to private schools, and were utilized much more than any other medium. Printed packs, much lower in the private schools, etc. But essentially the utilization rates of these different modalities was also higher in the private schools, which again, raises the issue of equity of access, which was mentioned on the first day. Showing you another graphic here, again from Sri Lanka, which is something which people, I don't think, thought sufficiently about initially. They just thought if children can connect to a device and internet, then they can learn. But of course, as particularly younger children, you still need support. You need support from teachers, and you also need support from parents if you're going to cope with learning from home. So here, if you look at, the data which strikes me most is that if you look at the graphic on the left, and that is the frequency of teacher contact during school closures. If you look at private schools, 52% of students had contact from teachers over 5 days. Only 8% of children in state schools had that contact. So again, you see the big discrepancies. And on the right, you see the discrepancies in terms of teacher support, parental support as well. And of course, more middle-class parents, more educated parents tend to give more support to their children than less educated parents. Well, that's not always the case if you have two educated parents who are both working. But again, you can see some inequalities on the right. So one of the big issues initially was the different development ages were trying to gauge what will the impact be on children's learning. And the initial sort of analyses and modeling was looking at things like the Ebola crisis, looking at earthquakes in Pakistan and so on, and seeing what extent that had impacted on children's learning. Because it's quite difficult to get assessment data on children's learning rapidly. But what has been very promising is that there is a study called ASER, which is a community-based approach to assessment. You might call it quick and dirty to some extent rather than the large assessment exercises, but it is rapid. And what we've really learned from the COVID period is that we need rapid responses. We need to know how many children are in school and out of schools rapidly. We need to know what they're learning rapidly in order that we can adapt the response to COVID. And I think the striking thing here is that in rural Karnataka in India, the proportion of children in grade 3, you could read at least a grade 1 level text. Now, grade 3 should be reading grade 3 level text, but this shows the level of the learning crisis before COVID. Okay, could read at least a grade 1 level text, fell sharply from 41% to 24% in 2020. That's a very significant loss. And then if you look at rural Pakistan, The percentage of children who can read a story in Urdu has already dropped from 42% to 23%. And that really shouldn't be the case if children are learning remotely, effectively remotely. The children who can do division in mathematics moving down from 34% to 15%. Read sentences in English going down from 43 to 25%. So learning loss is a really critical issue. And the really worrying thing is if children, if that is not addressed, whether children can really restart learning effectively. So moving on to my next slide. So this slide, well, first of all, I just want to refer to the statement from the World Bank here. What will be the impact of learning of COVID on learning will also, according to the World Bank, then translate into a major impact on children's lifelong learnings. They say they now risk losing $17 trillion in lifetime earnings in present value as a result of school closures. So again, I think the World Bank has been pushing for schools to remain open as long as possible, and also for good remediation in education. Now, in this graphic here is from the Brookings Institute in the US, and it looks at the long-term learning loss from COVID-19 school closures and mitigation strategies if you're looking, for example, at a grade 3 cohort. And what essentially it says is that the shock of an event like COVID could reduce grade 3 learning by 1/3. And this would have a long-term impact over time, which will still be felt when they get to grade 10. However, if after the shock you have good remediation, and I'm going to explain what remediation means in a minute, you can minimize that loss down to about 0.54 of a year learning loss. Also, if you can not only do the remediation, but also change the way that you do instruction. And just to say very briefly what I mean by that is that you teach in a differentiated way. You don't assume that all learners are at the same level. If you can radically change the instruction modeling, you can actually make a major gain. There could be a major gain from this crisis. Just moving on to my next slide. I don't know my slides. Oh, yeah, okay, I'll do it this way. So what is required to support these recovery efforts to make sure that this learning loss does not translate from being something short-term to being a learning loss for a whole generation of students? Well, financing is clearly a key enabler to learning recovery, and it should be prioritized as a gateway, not just to learning, but also to human rights in general and to human capital development. You will never have human capital development, you'll never have economic prosperity in this century unless you have high levels of learning across society and they have the right skills, etc., including employability skills. One statistic which is seldom shared by the donors is the discrepancy between investments in low-income countries per child compared to high-income countries. And it is very, very worrying. If you look at low-income countries across the world, it's about $48 per year is invested in a child's education compared to $8,500 in high-income countries. People seldom talk about this, but it's quite a shocking inequality. I just want to move down now to looking at investment patterns in South Asia pre-COVID, and we got data here on a series of different governments, including the one which is doing really well here is Bhutan. It's above the 6% GDP recommended by UNESCO. And Nepal is also doing quite well. And then down right at the bottom, you can see Bangladesh is really not doing very well at all in terms of percentage of GDP. And also Sri Lanka is not doing well. And it picked up, moving more towards 4% in 2016. But more recently, 2018, it's come down to around about 2% of GDP. So this will be a serious challenge, the amount of investment in education. Moving on to the next slide, more towards the qualitative aspects, what is required to mitigate learning loss? Well, one of the critical things is there must be curriculum modification. If during a school year, children are not covering the curriculum, you cannot simply assume that the curriculum has been covered and then move on to from grade 2 to the grade 3 curriculum. That could be very, very damaging. You have to modify, you may have to focus on critical subjects, etc. Another obvious thing which government should be doing is considering things like, well, certainly after there was only 1 year of learning loss, maybe we can just repeat the year. That would actually make a lot of sense if children have lost most of what they should have learned. However, many countries have gone for automatic promotion. And sometimes now with 2 years of learning loss due to COVID, it means that some children who were at grade 1 but didn't learn very much since being in grade 1 are now being automatically promoted to grade 3. I find that very worrying. Another critical thing is to do diagnostic and formative assessment to find out where children are before you move on with the learning program. Teacher support and capacity building will be really critical. And we should also keep parents, caregivers, and classroom assistants on board, because if we're going to move more towards inclusive education in classrooms, you need the personnel in the classroom to help ensure that you have this differentiated approach to learning. Learning materials are extremely important, an integrated learning approach. Sometimes people are talking about blended learning, so you can move from remote learning to face-to-face learning seamlessly. And some countries like Bangladesh are developing strategies on that. The other thing we really need to counter the infodemic is good communication strategies, right down to community level, from the national level to the district level, etc. And this has been a real problem in terms of the COVID response. And you need very effective monitoring, including monitoring the school attendance and remote learning. So these are things required to mitigate learning loss. And I think Sri Lanka is actually doing very well in terms of packaging these approaches. It's actually been seen as an exemplary country, and we've asked Sri Lanka to talk in Asia Pacific forums on how it's packaged its approach. Many countries haven't. The approach is very fragmented. So how can education be transformed to achieve SDG 4? What role might technology play? And what are the critical variables? So I'm moving on to the final part of my presentation now. And I just want to share this infographic. This is of GIGA, which is a global initiative supported by UNICEF, the World Bank, ITU, etc. And it's an initiative which is also, we've developed Asia Pacific Technical Working Group to further this work around reimagining education, building back better. And I don't really have time to go into it now, but essentially you've got to be looking at the content, connectivity, devices, etc. And I think one thing I just want to touch on before I move on, which I think has been understated quite often, is you need to look at the governance, monitoring, and quality assurance of what we do through technology for learning. And I think that came up with Hannah Singer Hamdi's presentation, the dangers of the infodemic, etc. Moving on to my next slide. So transforming education for all, what are the key questions? These are the key questions we need to ask. And I'm moving on to them quickly now. I think one of the first ones will be, how will people be learning? Well, I think the first thing to be stated is that children are already learning much more from informal sources like the internet than they are from classrooms. The second thing is that learning will be much more asynchronous. Now, not everybody will be learning together. Another thing which I think technology has shown is that we could be using a lot more simulations. So even if you don't have a science lab at school, you can still be doing simulations virtually. But most critically, I think from what I was saying before, we need to have more differentiation in classrooms. I hope that is how people will be learning. There'll be more learner autonomy, more differentiation. What should we be learning? A lot of people now are saying focus on literacy and numeracy foundational, and I think that's extremely important. But we also need to be looking at employability skills, what was called STEM, 21st century skills, etc. And we really need to be focusing in on science and making sure that education doesn't become politicized so that science is sidelined. And one of the critical things that we should be doing as teachers is that making sure that children can manage the infodemic, the social media, etc. Provision of learning, it's become quite disparate. Government, private sector was really blooming before COVID. It's retracted a little bit since COVID. And there will be a lot more provision of education as a public good. I think we have to be a little bit careful here. We don't want sort of KFC or McDonald's type learning packages. We have to protect the cultural capital of countries. So that's something to look out for. But what I do hope is that it may be that all adolescents can actually access online secondary education at no cost. That would be fantastic. So how will learning be monitored? Well, we have to move away from these very slow systems, go much more towards rapid systems, which can capture real-time data. And then finally, the big issue, I think, for agencies like the UN is how will we ensure that all children and adolescents are reached? This is going to be the big challenge because education is already transformed for the more elite children going to private schools and international schools, etc. Our challenge will be trying to make sure that all children also get those advantages. The final slide is essentially a list of key references, but thank you very much for listening. I hope I didn't go on for too long there. Over.
Thank you, Jim, for that most informative and interesting address. And I think much of that information is not known by many, although you have very scientifically provided this. I'm sure there are questions and comments, but one of the things that I've noticed is that of Professor Madhuma Bandara. Professor Madhuma Bandara, would you like to, or do you want me to say your question? Okay. Well, well, we have a reference to a lost generation, which Professor Madhuma Bandara is. His question is, your reference to a lost generation is challenging and interesting. Can you elaborate, characterize the salient signs of that generation?
Yeah, would you like me to respond to that
yes,
immediately?
Yes, please.
Yes, please, I can hear.
Yeah, well, I think initially we were really not aware of the scale of the learning loss, but if you look at the data that I presented from ASER in India and Pakistan, we can see that children have already lost a lot of what they've been learning at school, because they've been out of school for too long, but also the quality of the remote learning has not been very good. But I think issues like that can be addressed. I mean, you will talk to many eminent people who, for example, whose education was disrupted due to wars, etc. In our own case in the UK, we had the First World War, we had the Second World War. Not everybody who was going to school during that period turned out to be sort of deficient in terms of personal capacity. But we can see that there has been quite an immediate shock on children's learning. So the issue really is that we really need to focus in on those remediation efforts. And one of my main worries with I think even the international agencies was that in a sense, there was too much focus on reimagining education and the technology response in the longer term, and not just getting stuff together properly in packaged way so that children catch up on that learning rapidly and they get those building blocks in place. I mean, I think particularly in subjects like mathematics, if you were to jump from grade 1 to grade 3, which is happening in some countries, without those foundational blocks being in place, children will learn nothing in mathematics. So it is a real worry, but I think it is something we can address if we do it systematically.
Thank you, Jim. Nadira, you have a question? Would you like to? Nadira's question is, how do you suggest we deal with the assessments or barrier exams that continue to operate?
Yeah, this has been a huge issue in many countries, and it's something which has also been, politically very charged, because parents with children coming up to examinations whose future is threatened because sometimes they weren't able to hold the examinations, etc. It's a very tricky one, and I think in countries where you also have things like continuous assessment in schools, like for example in the UK, where there's continuous assessment, the assessment of the teacher is actually being used for the final summative assessment of the student, rather than a formal examination. But this is certainly a critical challenge. But the other thing I was trying to say about assessment as well is that we should not be focusing at the moment so much on what we call assessment of learning, but assessment for learning. So what we should be doing, and this is something you do at the classroom level, is trying to assess what areas of the curriculum do children understand now before you move on with the curriculum.
That's a question which answer is a bit obvious, but I nevertheless put it. It's about the point that you brought in, the difference between the public schools and the private schools. And the first comment here, as you see, children in public schools always have the higher tendency of missing out on lessons during lockdowns, whereas those in private schools they had a greater advantage. Now, how can this challenge be overcome? It's the inequity that's there, but I will ask Jim if you have any other comments to make.
Yeah, I mean, there's whole literature around private schools and private schools for the, not just, I mean, private schools can be elite schools, but you also have private schools for the poor, where the state doesn't reach. And it's a very contested sort of area with several eminent sort of academics, some pushing for the privatization of education, saying that state education simply isn't working in low resource environments and so on. But I think the data that's come out more recently suggests that countries that have gone more towards marketization of education, which is something which, for example, Margaret Thatcher was pushing in the UK and President Reagan and so on, countries like Sweden that have gone more for a market approach, the aggregate learning level of children has actually come down. So it's created more inequalities. But I think the way to look at private education is that I think state education has to learn from private education. And one of the reasons why private education is often more robust in situations like COVID is that there is an accountability between the teachers and the parents. And that's partly because the parents are paying fees, so they can hold teachers accountable. But I don't see any reason also why teachers and head teachers cannot be held accountable to parents in the state system as well. We have to look at what making things work in the private sector, in my view, and apply those to the state sector as well.
I think there's just time for another 2 questions, but there's one interesting one. Is there some strategies or plans for recovery of learning loss? I think this learning loss is some very important point that you brought out, Jim, but are there some strategies, particularly for South Asia, as you are very closely involved?
Yeah, at UNICEF, we actually, UNICEF Rosa, we coined this phrase called the essential learning packages, because we think it would be very arrogant of us as an agency to develop a package and say everyone should buy into this package. But essentially, what you need to do, and there's one of the slides I tried to dwell on a little bit, is that you need to package that approach. And I think in Sri Lanka, it has been done well. Part of that packaging is that you have to do the diagnostic assessment to try and find out what has been learned, what hasn't been learned, right. And then the formative assessment, how each individual child is proceeding. You've got to train the teachers, you've got to get the right materials in place, you've got to adapt the curriculum, etc. So yeah, I think you have to have a sort of a coherent packaged approach to this. And remediation is not something you just do over a few weeks. It may have to actually continue either in parallel. In fact, really, it has to come before you resume the normal curriculum. You have to do the remediation before you start going back to the curriculum. The biggest risk is a teacher will say that, okay, 2 years ago, we were on page 5. Now it's, we're starting class today. Let's go on to page 6 and continue as if nothing happened. And you're smiling there, Ranjiv, but actually in reality, that is happening in a lot of places. Yeah, governments just want to get, they don't want to be seen to be pushing children even further behind. Let's just crack on. Let's just pick up the textbooks and carry on as if nothing's happened. So that is really dangerous, yeah.
The last question is that you showed very clearly the drop in investments on education in South Asia. But, and also COVID pandemic has actually affected the economies of all these countries. Now in this complex situation where the government will have to now balance the investment on various other services, if there are any plans to advise governments on increasing education allocations in the light of what's happening with COVID?
Yeah, I mean, I think what I was trying to say, and perhaps it was pretty information heavy, what I was saying today, is that I think the best way to convince government of the need to invest in education is not just to focus on learning outcomes, but also to look at development in terms of the individual, in terms of society, in terms of the economy. The human capital focus, I think, is really, really important. And of course, there will be a temptation from some governments now to focus in more on other sectors than on education. But I think if countries do this, ultimately their human capital in comparison to other competitive countries will be reduced. So I think that is a very dangerous thing. And I just want to say a final comment as well about something I didn't touch on, but I feel very strongly about, is that I think we now have an opportunity to really refocus again on health promoting schools. And what really came out of the pandemic was initially people thought it's quite exciting. Everyone can learn by themselves, no need to go to school, etc. But after a while, we saw that children were really missing school. They were missing it for the social aspect. And then the poorer children were also missing things like school meals, health education, etc. Mental health has been a huge issue. So I think the COVID response in education has got to be a cross-sectoral response. And again, I think Sri Lanka has actually done very well in that respect compared to most other countries in the region.
Great. Thank you so much, Jim. And it was very comprehensive presentation. And we also note that this will be your last UNICEF presentation. And we wish you very happy retirement, very busy retirement. And then I do hope we'll be in touch. Thank you once again, Jim. This would have continued if not for the time constraints, and catch up with you later. Thank you once again, Jim.
Thank you very much.
Thank you.
It's a pleasure.
Thank you. We now move on to the next lead paper by Professor Vivian Lin. Professor Lin is the Executive Associate Dean at Li Ka-shing Faculty of Medicine at the University of Hong Kong. She has 40 years experience in public health. She was the chair of public health at La Trobe University in Melbourne before serving the WHO as Director of Health Systems in the Western Pacific Regional Office. She is the author of several leading textbooks in Australia on health policy and planning. Vivian is also consulted widely by the World Bank, UK Department for International Development, Australian Agency for International Development, as well as she has served on multiple boards in relation to health promotion, public health, education, and research as the chair of the Australian National Network of Academic Public Health Institutions, and complementary health workforce regulation, notably as inaugural president of the Chinese Medicine Registration Board of Victoria, and China relations, including Australia-China Council. Vivian has a BA from Yale, an MPH and BPH from Berkeley. And I'm very pleased to invite Vivian for this presentation, which will be on science, health, and foresight analysis. Foresight in the time of COVID-19. Yes, thank you.
Thank you so much. It's a great pleasure to be able to join you. There's been, we know, a huge amount of collaboration in the time of COVID between the basic and medical sciences. And as our opening speaker said, it's time to bring in the social sciences as well. And in talking about foresight, I will be talking about the interdisciplinary work and bringing in more social sciences with a focus of thinking about building back better and beyond. So more specifically, what I will do is to talk in more detail about the COVID Futures think tank that the World Health Organization of the Western Pacific Regional Office had actually undertaken using this methodology. So let me go to my slide share. I am not sure why. Apologies, found it. Okay.
Thank you.
So there's a number of acknowledgements to be made. The first is really to all the public health experts who have long predicted that we were going to be seeing a pandemic sometime in the future, and the future is now. And of course, it may be one thing to say it's coming, it's another thing to think about, what do you do? So the regional director in the Western Pacific Regional Office, on taking office in 2019, suggested that to be prepared for the future, we need to actually think about backcasting as the way of working. So then COVID struck, and the Futures think tank were really the first attempt to use this approach to see if it actually helps us manage better and recover. So 4 think tanks were held around COVID. I'll describe the non-pharmaceutical interventions, but there was also one on equity, one on economics, one on ethics, and one on non-COVID mortality, for instance, cancer, heart disease, etc. And coming out of that, people said the history also matters because where we are today is a reflection of yesterday. And today is going to actually frame tomorrow. So there was another think tank on history that was held. And of course, all of this has been supported both by the WHO staff and also professional support from people who might be labeled futurists. So I want to just acknowledge all the input from these people in what I will be talking about. And so I want to talk a little bit about why foresight and what these think tanks did. I want to tell you about what were the conclusions based on this methodology back in 2020, but also here we are in 2022, how do we actually reflect on that exercise and then talk about the future of foresight in the WHO and beyond. But because yesterday comes to today and today leads to tomorrow, I want to start with history. History of epidemics matter a lot. And when we think about history, we know that the public health system as we see today had some of its early origins during Black Death, when Italian cities set up temporary boards of health and then made them permanent. At that time, they issued passes to travelers and they instituted quarantine arrangements. And of course, that is what we're also living with. But these past epidemics have also led to changes in health services delivery. During the Black Death, plague hospitals were invented to isolate those who were ill. In the Spanish flu epidemic, just over 100 years ago, flu hospitals were also set up, but they went beyond isolation, but to also provide supportive care to individuals to help people recover. So we can see how there has been cumulative lessons. But the thing that we have perhaps not learned as much is every epidemic has revealed structural inequalities in our society. As example, the cholera outbreaks in the 1800s actually fueled a lot of social unrest. There was an emerging sanitary movement that pushed for clean water and wastewater. So this is interesting to reflect in our current circumstances where we see structural inequalities, we see social unrest, but we are also seeing some movements to build back better in a number of different ways. So then the question becomes, having had COVID now for 2 years, what can we anticipate and plan better in order to recover and to prepare for the next epidemic? I think there are a lot of shared experiences of a negative, but not completely negative sort. If we think about the early days of COVID in so many countries, we had supply problems, whether that was the public health supply, the equipment and devices, or the care supply. We saw in every country that there were certain populations that were very high risk. These were migrants, the people in insecure employment, people with underlying conditions, many of whom are aged. And we also saw the rise of mental health issues, gender-based violence. And many countries responded with vaccine nationalism at the time when global solidarity was being called for. But behind every one of these experiences, there were also some transformational transformational possibilities that emerged. Digital health is a big one in many, many places. And those changes look like they will stay. Many countries started to reorganize supply chains. There was much greater focus on primary healthcare and community engagement. And outside of the health sector, we've seen engineers talking about better quality buildings, healthy buildings. We've seen people in social sector talking about the need for better social protection systems. And many businesses are now preparing for whether the workplace will be transformed because people want to continue to work from home. So how do we actually bring this into the future? Well, I have to say that historically, public health hasn't necessarily been particularly good at this, in the way that conventional disease control programs work, and our response to COVID certainly initially wasn't this approach. It's very rational. We look at the scientific evidence, we look at the epidemiology, we look at the data. We assume that we can control the risk factors and we can fix it, and there's not going to be external disruptions. Well, this has not quite been the COVID experience, but we do have other examples where foresight has been applied, typically not to disease control, but to complex public health problems. When linear thinking was not sufficient, or there were certainly many uncertainties. And some of the most notable examples globally, the UK had a foresight program that looked at the myriad of complex factors that was contributing to the obesity problem as a way of helping to think through the solutions. And the Dutch undertook a foresight study as part of the development of national health policy. And perhaps surprisingly, for many, compared with the beginning of the exercise, youth mental health emerged as a really significant priority. And in Australia, the Cooperative Research Centre for Aboriginal Health, now known as the Lowinger Institute, actually used foresight as a way of research priority setting. So instead of thinking about what's today's issue, they really said, what's the future that we need to have better research? And then thinking about how research can help pave the way for different kinds of futures. So in a nutshell, there's a number of different ways in which foresight can be useful. Foresight in the first instance helps you ask good questions, critical questions, systemic questions, provocative questions. And in doing so, it challenges the assumptions and the things that we take for granted and push us towards more innovative thinking and better preparedness. It boosts the creativity in the way that we do our analysis and in the way we look for solutions. And instead of thinking for the one size fits all, what's the one magic bullet? What's the one intervention that will fix it? We accept diversity of context and therefore a need for a range of different tools and interventions to solve our problem. And in that way, we can manage uncertainty better, we can test different ways of working, and we can think about adaptation and resilience. So what does it look like? Well, in the top, we see that linear thinking, where we think about the facts, we think about the trends, we try to predict. And so forecasting is one of the very standard practices we see in many disciplines. But when we think about futures work, foresight, we are thinking about scenarios. We recognize the present reflects the past, but what we want to do is to envision the future. We want to think about alternative scenarios. We want to understand the drivers of change that gives us these uncertainties. And then we want to do our backcasting to think about how do we get to different futures. So let's go into an example of a futures think tank. Now, remember that this was April 2020, about 3 months after COVID started, when knowledge was still evolving. And I want to give you example from the non-pharmaceutical interventions, which is sometimes also known as community mitigation. And this is what we talk about as social distancing, wearing masks, and so on and so forth. And so in doing this think tank, the WHO wanted to think about how the implementation of these measures between that point in time of the pandemic and when the vaccine became available will impact on people's health systems, and what did it mean for moving forward. Now, the interesting thing I also think to reflect on 2 years down the track is some of the trends and the assumptions that we actually had. Firstly, one of the assumptions in going in is that the social distancing and other MPI measures were appropriate and would be accepted by most of the community, so perhaps underscore most. We thought that effective vaccines would be available in 18 to 24 months, and it turns out to be more like 18. So we were not too bad on those two, but we also thought that there would not be very much mutation, so the vaccine can be developed quickly and be highly effective. That we're being challenged by that. We were also thinking that the biological response would be predictable, and therefore antibodies would protect from reinfection. Here again, the science is challenged our thinking, but nonetheless, part of the future foresight work is being able to take account as you go on. So what did we do? Well, essentially, it was a 6-fold methodology. The trend analysis was looking at the facts, the epidemiology, the economics, and so on. But what I'll try to describe are some of the other steps. The first one is the futures wheel. I'm not going to get into these in great detail, but just to illustrate the kind of thinking, doing a futures wheel is kind of like doing mind mapping. So you start with, the trend and what's going to happen. And then you think about, why would that happen? What were the drivers? What might be the consequences? And so you start to link issues of health with education, with the economy, with social institutions. But most importantly, it's about also testing this with wildcards. So here's some wildcards that we thought about at the time, whether there was going to be, weather events, whether there was going to be famine, whether there might be war, other kinds of disease outbreaks. So you test your scenarios with these wildcards to see what might happen and whether these scenarios might then go off in different ways. Then we thought about the intersection between the different kinds of impacts. So here we were looking at social, technological, economic, environmental, and political. And from there, we go on to scenario building. And this is really the most fun and creative part, where we said, let's see what might be the different kinds of scenarios once we take account of the social, the technological, the economic, the ecological, and the political trends. So these were 4 scenarios we came up with back in 2020. The pessimist was a dystopian future, a life post-COVID where society fell apart. There was social unrest, breakdown in the rule of law, rising criminal gangs, people lost faith and trust in authority as examples. Health system collapsed, health workers resigned, walked out. There began to be an informal health economy, and poverty was widespread, economy was bankrupt. So that was the dystopian view. Then there was the new normal where COVID is just partially tamed, but the state had to constantly impose more order. Outbreak gets contained, but it resurfaces. US-China tensions threaten to cause the WHO to collapse. Widespread unemployment, bidding war for the vaccines, states turn inward looking. Immunity passports come in, and WHO is struggling as countries also try and figure out their directions. Then there was the optimist view, where the vaccine's on the horizon and we recover. We go back to the pre-pandemic days, but we're doing even better with more progress. We flattened the curve, businesses reopened, but stimulus funding is helping the economies to grow. There's good trust in government because people have benefited and vulnerable groups are supported, and digital technology use has exploded. And finally, the fourth scenario we had is really kind of two different worlds coexisting, where yes, the pandemic comes and go, there's some recovery and some funding, but the population, society, it's fragmented. The health system becomes two tiers. The people with immunity passports get to do things. Other people are excluded from social activities. There's good private sector innovation that has happened, but others are left behind. So I'm sure when I describe this to you, there are elements that are familiar. What we identify was, despite differences across these scenarios, there were going to be some shifts that was going to be universal. We will see behavior change, and more things people know about and they can do at a distance. We're going to see people more focused and understanding of mental health. We will see new business models, new forms of healthcare because of the digital revolution that has been accelerated. We believe that government's role was going to be much more expected. And then the inequalities would actually also increase. So these were some of the things that we felt we could reasonably expect across the scenarios. And from there, what you do really depended on the governance system, the politics, the ideology, and the values in society. So here, in order to help the WHO think about how to work with different governments in the way that WHO provides support, we started to think about the different political orientations, the different social values, and whether with the different scenarios, governments would actually move in different direction. So from there, we can backcast and we can think about, for each of the scenarios, what does it mean? And what do you want? What should you do? And so this is really also a choice about what don't you want and what should you do to prevent a certain scenario from happening. And then we went through to work out what is the WHO and how does it work. And from there, we looked at if there were preferred scenarios in 18 months or 2 years' time, then working backwards, where should the WHO be today in 12 months, 15 months, 18 months? So that's really the backcasting process. So what did we actually conclude for the WHO? We told the WHO that they really needed to help countries to develop more resilient and future-proofed pandemic preparedness plans so that they can actually protect themselves against the worst scenario. We said countries must not lose sight of universal health coverage, because if you haven't got a health system that was prepared, you're not going to be able to respond appropriately. We wanted the WHO to support countries to really embrace digital health technologies as a way of transforming the health system, which includes better quality, better access, and being more responsive. And we wanted the WHO to strengthen the support on ensuring mental well-being and give that much more attention across countries. And we wanted WHO to remind countries to ensure that they didn't put aside all the other disease control programs, whether that's maternal and child health, immunization, non-communicable diseases, and that all the needs of the population still required attention. So the interesting thing about this set of conclusion is that it actually went beyond business as usual, because in the world of large, complex, bureaucratic organizations, you have many vertical programs, and something like COVID might have been seen initially as something just for the health emergencies program. And it's all about, global health security and joint external assessment and ticking the boxes on pandemic preparedness planning, which does not address many different issues. So this really led to a pivoting of the entirety of the organization to the COVID response. Now, later on in 2020, we did do some reflection as the various think tanks work its way through, moving towards a futures forum. And we thought that, in reality, it's not going to be 4 different scenarios. We probably would end up with a mixed scenario that required lift and suppress. And this is indeed where we are. We thought the 4th industrial revolution of digital technology would really accelerate, and we have certainly seen that. We felt we needed to work to ensure the equity impacts were not forgotten, both within countries and across countries. This one, we still need to really keep our eyes on. We thought that organizations needed to pivot, and it did. But we wondered about the future for evidence-informed policies and many other issues in global governance, and whether things will change or whether things will revert. And that's an interesting point to talk about. But we also reflected on the methodology and the process. Now, this was a rapid process, so it really is a matter about getting the range of people around the table. Had to be a right mix, people who knew the evidence about the virus, about the social impact. And we found that having a multidisciplinary group with people who understood different countries and different population contexts was very important. And this type of exercise, bringing in the diverse disciplinary inputs, was very helpful for people who were otherwise very narrowly focused on the details, the technical details of the disease, the virus, the clinical presentations, and important as it might be, they may in fact manifest themselves differently. And we certainly found it was a very helpful process to get the different stakeholders onto the same page. So let's move to 2022. And here we are. What does this look like in retrospect? I think that we can, in fact, be reaffirming the value of this foresight when we think about the domains of impact and action we were most concerned with. Certainly, we saw the unleashing of new technology, but sometimes without necessarily assessment of risks or impact. We certainly have seen politics and governments being hijacked. We've seen perhaps a lot of discussion about, is it globalization in a different form? In the communities around the world, we've seen communities, all of us, living with uncertainty, stress, and pressures, and greater inequalities and vulnerabilities with polarizing and fragmented societies. But we've also seen people come together, being much more health conscious and thinking about my health and your health are actually intertwined. In the health system, everywhere, we see a workforce that's been pushed to the limits. We've seen loss of life expectancy, and we certainly see the world's eyes on the WHO. So I think that exercise we can reaffirm the value of the exercise. And what would we actually learn in terms of thinking about where it can help us? It certainly helped us map the complexity for more holistic response. It highlighted emergent issues. It moved us to consider a full range of possibilities. I mean, back in 2020, Donald Trump was definitely one of the wild cards we talked about. But we also considered strategic opportunities, getting a recommitment to universal health coverage, indeed, to the Sustainable Development Goals. So, having done this kind of exercise, we can see it's not just for the pandemic, but it has greater value. And the WHO at headquarters is now certainly looking at developing a foresight function within headquarters, and with it to support all different health programs. And essentially, using foresight is about asking some critical questions. Firstly, what's changing and what's driving the change? What's the longer term dynamics that will change things? What might be the impact of these emerging changes? What are the alternative scenarios? And what are the different futures that these changes can occur? And then we go to the normative. What's the future we want to build? And how do we create the change that we want to see? So it does take you from the analytical, the multidisciplinary consideration to a normative approach. So in conclusion, I think that when we reflect on the last 2 years, we have seen rapid collaboration of the STEM scientists in medicine, in engineering, the data scientists, the lab scientists. What we could see more, or what we need more, is more collaboration of social scientists and collaboration across STEM and social sciences with economists, sociologists, psychologists, political scientists, because I think this is what a foresight approach demonstrates the value of this very broad interdisciplinary collaboration. So if we have more interdisciplinarity and more focus on implementation science, perhaps we can really move the world a bit further to creating the kind of futures that we want to build as we emerge from COVID. And if we also could bring in stronger evidence for foresight itself, as well as for translational work, I think that can really propel us to a better place. So let me finish there, and thank you very much.
Thank you, Professor Lin, for that most informative discussion and opening up the whole question of foresight analysis and approaches. We just run out of time, but we have just 1 or 2 questions. Priyan, would you like to put out your question on where does this capacity reside?
Yes. So I just want to know whether the UN system wants to promote these kinds of studies, and maybe among governments or even among academies of sciences. I mean, speaking from our own perspective, because it does not seem to me it's not a very widespread expertise, right? I mean, can you comment on that?
It is a fairly small group of experts, and the experts are not content experts in the subject matters, but they're methodology experts on what's the range and what's the process, what do you need to do to help people do that. The UN system is very interested, and there are now many UN agencies that are looking at how do they bring foresight in better. I believe UNESCO for a number of years did have an in-house futures expert as well. So
maybe insurance companies have them, right? Maybe insurance companies have them.
Insurance company might be more responsive, but what the Western Pacific Regional Office certainly is doing is now supporting countries to actually look at doing this better. Now, we do have some countries like Singapore, which has long-standing presence of a foresight unit. And I think Singapore has been, pretty well served. But for low and middle income country, there's no reason why they could not also do this. So that's certainly part of the process.
Thank you. There's a question by Elisha Nasruddin. Question is, the value of futures thinking comes from the ability for imaginative collaboration for a better future. Yet, how did your exercise highlight the resilient society of the future?
Let me think if I understand, highlight the resilience society. I think when we actually, it's almost by definition that when we take a futures approach, we think about resilience, because at any point in time, there will be shocks. And how well do individuals, groups, communities, nations, our planet respond to the different shocks? And so when we think about the future and we look at the wild cards, we anticipate different kinds of shocks. We start to raise also awareness about how do we actually build the resilience and what does it take? It might look different in different places. Your starting points will be different. Your culture, your governance arrangements will be also different. But I think by bringing in an multidisciplinary perspective and an understanding about how different sectors have experienced shocks and recovered, it helps strengthen our capacity to deal with it.
Thank you, Professor Lin, and thank you so much for that very interesting and very, novel approach that has been presented. Thank you. We now move to the next presentation, which in fact, as I said at the beginning, is the presentation by Dr. Melvin Jabba with the title, Share as a Symbolic Object in the Time of COVID-19 in the Philippines. I think we have a recording sent by Dr. Jabba, who is the director of the Social Development Research Center and the professor of the Department of Sociology and Behavioral Sciences of NASSL University in the Philippines. He has a Master's of Health Social Science from NASSL and a PhD from Asia Pacific Studies at Retsunuikan Asia Pacific University. Can we play the recording of Dr. Jabba's presentation, please? The team. I think Dr. Jabba is also present, if I'm
Good afternoon to everyone. Again, my apologies. I was not able to present last night due to my internet connection problem, but nonetheless, I'm thankful to the organizer for giving me an opportunity to present my paper, although this is going to be recorded.
Yeah, thank you.
The central theme of this presentation involves an example of how a physical object, in this case a chair, can have different functions and meanings as a result of changing social and environmental conditions, not only as an adaptive response. Good afternoon to everyone. Again, my apologies. I was not able to present last night due to my internet connection problem, but nonetheless, I'm thankful to the organizer for giving me an opportunity to present my paper, although this is going to be recorded. The central theme of this presentation involves an example of how a physical object, in this case a chair, can have different functions and meanings as a result of changing social and environmental conditions, not only as an adaptive response, but reification of prevailing social realities. Such realities can either be reinforced or suppressed by these very specific social and environmental conditions. The paper which this presentation is based on is inspired by my personal and hopefully astute observation of how the chair as a physical object has transformed in the time of COVID-19 relief operations. During the distribution of relief goods, or ayuda in the local language, in many provinces of the Philippines, families were asked to place a chair outside their home to avoid human contact during delivery and hence lessen the transmission of the virus. Unlike in other countries, distribution of relief assistance in the Philippines in the form of both cash and goods was done manually through house tours visits and face-to-face cash distribution. What is unique in the Philippines case, however, is the provision of repacked relief goods which were distributed in local communities. In this presentation, I discuss how the chair as a physical object represents social realities in the Philippines, even in a situation like a viral pandemic. A chair in this regard is taken as cultural material, and its function develops through time. This paper is anchored on symbolic interactionism and uses it as a lens in making sense of how objects are given life by humans. As we are probably all familiar with such situations, symbolic interactionism alludes to the idea that people make meanings or attach meaning to objects, depending on how such objects are given a meaning at a specific point in time or in a particular social and spatial context. My paper is based on how I and how other people see the chair as an object in relation to relief operations in the Philippines during the COVID-19 pandemic. Data for this article has been called from netizens' Facebook posts relating to the chair and to its role in relief good distribution. I also searched for news articles regarding the use of the chair in relief operations and engaged in some FB chats with people who posted related online materials for clarification and probing. Although quite minimal, I also made reference to my personal experience in receiving relief assistance during the pandemic. The chair as a physical object, or as described by Apadurai, a physical object has social significance. In fact, he argues in his 1986 essay that the human-object transaction can be mediated by social or people-to-people relations. In other words, the way a person relates to a physical object can be influenced by the person's relationship with other human beings. Drawing on Apadurai's argument, one can say that the chair as a physical entity is given a life through social interactions. While it is expected to provide function, the chair as a physical object becomes more than what it is through social interactions. Objects as material culture also legitimize various social positions. In fact, Bourdieu in 1984 clarifies that objects reinforce social positions in a given social structure and set the difference or divide between groups. Apart from its physical function, the chair is also transformed into how societies attach meaning to its object, to its being rather. Material objects, while they are taken for granted on many occasions, can become suddenly important, especially when they're able to provide significant unintended utility to their possessors. As a result, humans begin to see themselves in those sub-objects, hence the material object is given life. As earlier mentioned, this presentation describes how the chair in the time of COVID-19 has functioned and how people have used it to convey social messages. It also likewise narrates how the chair is used to reflect social realities in the Philippines. The paper identifies 4 major themes to describe the chair as a social object, namely, the chair as a symbol of anticipation, as a symbol of social solidarity, as a symbol of class divide, and as a symbol of social trust. When told about how relief operations will be handled, people took their chairs to the streets full of anticipation that they would be able to receive ayuda from the local governments. The relief assistance varied from one village to another. Regardless of the content, people hoped that they would be given the very much needed food assistance, as many lost their jobs as a result of lockdown and suspension of work operations. In one post I saw on Facebook, a netizen excitedly shared that her family's chair was ready to accept relief goods. According to her, I quote, "They said we have to bring our chair outside so we can receive the relief goods. Our chairs are now ready," unquote. Interestingly, netizens refer to the chair as the entity that receives the relief goods instead of the person or the family who owns it. In this regard, the chair as a material object rather, somehow developed its being or spirit, as if it is the very entity that is actively receiving the relief goods. I see this being or spirit as an extension of the possessor's self. For instance, one netizen referred to the chair as the one who received the relief goods and not the possessor. The chair or absence of it also appeared to be a symbol of social solidarity during the pandemic. This was manifested in a number of appeals made to social media and in the news. A news report written by Serato in 2020, for example, relayed the appeal made by a mayor to those who were economically better off not to accept the relief goods in order to give priority to those in dire need. The mayor specifically requested families to put up a sign saying, "Pass, please give the goods to other families who are in need," instead of a chair in front of one's residence. Another case relates to a neighbor of mine who made an appeal to our village homeowners FB group to place 2 chairs in front of the house, one for the relief goods and another for in-kind donations. Through her post, she hoped that families would be able to donate any goods that could be given to those who were distributing the relief assistance or to other families who needed help. There was also a clamor to FB post for families who were better off to refrain from putting their chairs outside to enable needy families to receive more assistance. The spirit of solidarity is not only manifested through the foregoing receipt of relief goods, others walk the extra mile by also offering something to those who are distributing the relief goods or by voluntarily offering relief goods to their neighbors. For instance, one netizen offered water to those who were distributing the goods as she thought that they must have been tired and thirsty. The chair unintentionally manifested the prevailing class divide in the Philippine society. This could have emerged as a result of the debate on whether or not middle-class households should be given assistance by the government. A Rappler news report entitled, "Should the Middle Class Receive Subsidy?" focused on the plight of middle-class Filipinos who were not prioritized in these relief operations. In the said report, the Ibon Foundation Executive Director emphasized the call for the middle class to stand in solidarity with the poor to demand better government support during the pandemic. The prevailing class divide was manifested in the kinds of chair being placed outside the house. To avoid humiliation and to make sure that one would receive the relief goods, chairs brought out were usually made of plastic, which symbolizes indigence. Although it was intended to be a joke, a netizen posted a picture on Facebook showing 2 chairs. One was a small chair made of plastic, while the other was covered with shiny velvet and fancy glitter and had an elongated chair back. The netizen wondered if the relief goods would be placed in such type of chair. As a reaction, one netizen responded saying, "How can you be given relief goods when your chair is beautiful? Of course, they are not going to give you those relief goods," unquote. Another netizen reacted that it was unlikely that the owner of the grander chair would receive relief goods because it seemed to indicate affluence. Due to difficulties in ascertaining who owns which chair, many of the relief operations, especially in urban areas, depended on trust. Unlike in rural areas, houses in urban areas are crowded together and are sometimes inaccessible due to the narrow alleyways. In addition, many households in informal settlements are occupied by 2 or more families. This situation complicates the distribution of relief goods as there was no way to monitor who actually received the relief and who owns which chair. One netizen, out of curiosity, wondered if the chairs were legitimate and truly represented a household. In another post, a netizen complained because a chair was placed in front of a vacant lot. The netizen shared, I quote, "Ayuda or relief goods is so much in demand that even the vacant lot has a chair in front of it, unquote. A local government unit in the Philippines appealed to each family to place one chair in front of their residence and to give their full cooperation. As mentioned at the beginning, this paper aims to reveal how material objects like chair can acquire diverse symbolism depending on time and space. In the past, chairs have been used to convey affluence and power. As Cragon Reid in 2018 notes, chairs can signify wealth, power, and status. The type of chair one owns could probably reveal one's social position or standing. As shown in this presentation, symbolism of chair can change over time, and what is favorable in one context may not be favorable in another. For instance, during the relief operations, while it was conveyed as joke but pun intended, an expensive chair was seen as a symbol of affluence and expressed that owners of such chair should not be given relief goods. As manifested in some FB posts, people displayed objections when richer households would be given the relief goods. As can be gleaned from the narratives, it is apparent that the meaning of the chair has indeed evolved as a result of the COVID-19 pandemic. This suggests that pandemics are by themselves forces that may undermine or reinforce societal norms and practices. Relating to the conference theme, this presentation has made use of a chair as a symbolism that in the future, social interactions will probably become lesser as people are now able to devise strategies that somehow limit face-to-face interactions that when overly done could result to alienation. This changing view of the chair represents a kind of post-pandemic COVID where social interactions will be limited and that a new normal is forged. For instance, in the Philippines, there are plans now, not only by my university, but by the government to make education hybrid instead of holding face-to-face classes all the time, as many students have purportedly adopted to the modular or online learning approaches. That ends my presentation, and I hope that you enjoyed my presentation.
We don't have time for any questions, but just a very brief interlude in 2-3 minutes. We will start the next session. We are already behind schedule, or I can see Dr. Sether is already online. Maybe, Priyan, shall we start the paper or do you want a short break?
You can go ahead and start, yes.
Yeah, I think so, yes. Thank you, Dr. Jabba. I'm sorry we can't take questions, as I said, because we run on to the next paper. We are now on to the lead paper on long-term social impacts of COVID-19 on education. And I'm very pleased to invite Dr. Upali Sether, who is the Secretary of the State Ministry of Education Reforms, Open Universities and Distance Learning Promotion of Sri Lanka. He also serves as the Chief Executive Officer and the Rector of the Sri Lanka International Buddhist Academy at Pallekele in Sri Lanka. He's the author of the book, Reforming Education, Globalization and Low-Income Economies and the Crisis of Vision, which is a prescribed text in many universities in the world over. His other more recent book, Education Meeting Knowledge Economy, the 21st Century Expectations, has been well received internationally. Dr. Sether has over 100 refereed publications and has served about 20 years in Sri Lankan universities. He was also the Director General of the National Institute of Education in 2009 and 2010. He worked with the United Nations in about 1987, but has been with the World Bank in 1991 as an education sector project monitor. I know he's very busy right now on educational reforms, and I'm pleased to invite Dr. Sether for the presentation.
Thank you, Ranjit. Happy to be here, and I know distinguished set of participants. I was listening to the previous presentations and was very happy to hear those presentations. Should I share mine or you are going to put it, or do I have to put it?
Please share your screen. Yeah.
Okay. Well, it is not opening. Do you see the screen?
Yeah. Yes.
Yeah,
Okay.
now it's okay.
Thank you.
Yeah.
Thank you very much. I will be brief.
You can see this.
And, this is the pandemic that really perhaps had the biggest impact on economy and education. Although all the UN findings, health findings indicated that children are the least affected and they had the best resilience for the disease. Yet schools had to be closed because the particular reason is that mothers, particularly the parents, didn't want to take the risk of sending children to school. I remember when the very first case was found in Sri Lanka, the same day people panicked to remove children from their schools, and immediately that evening we had to decide to close the schools. So actually taking the numbers into account, you can see the position of UNESCO as well as UNICEF had been that, the children are the least affected by the disease. Therefore, education perhaps could have been continued. But, the public image was different. So the pandemic had a lasting impact on education. This is data that I have collected from UNICEF and UNESCO data. I have seen in a previous publication also another speaker used this chart. You can see that the number of days the schools are fully closed. Here, Sri Lanka is the last country here listed, is 141 days. Our schools were fully closed. And another 37 days, schools were partially closed. But we were not the worst. Here you can see that the Bangladesh had 198 days fully closed. So was Myanmar, Philippines, many other countries were fully closed for a longer period than this. Sri Lanka, time to time, had partial opening, full open again for a short time, and then had to close with the second wave, and then partial opening again. So now the schools came to normal running on November 8th, but somehow we know we were afraid of the third wave, and with that again, we had to close school. Vacation was around the corner, but we decided to close it early. Actual fact is that, we were again scared whether the disease would spread faster. So now, of course, the examinations have been conducted. It is going on, and very likely on March 7th, we are reopening as we have scheduled. What are the implications of these schools closure is what matters actually. You can also see many countries, according to UNESCO, their investment in education was anyway low even before COVID-19 pandemic. Sri Lanka was one of these countries among these countries. You see, Bangladesh, Myanmar, Sri Lanka, Cambodia were below the average investment in education. But with the pandemic, you can see this is also again UNESCO material. You can see that the GDP growth really went into minus values. Sri Lanka is again, this red color is one of them. Worst hit was Maldives. Then India, Philippines, all they had minus growth, except few countries in Asia like Bangladesh had still it was a plus GDP growth in Bangladesh, Myanmar, China, Vietnam, and other places. There are lessons to learn from this also, because Sri Lanka was also the Maldives. worst hit countries among them, because our economy is almost 68% or 66 to 68% of our economy depends on service industries, not the industries. That is the reason, opposed to Bangladesh. If you take, Bangladesh was in the historical year more vulnerable country than us, but today doing well because Bangladesh has a very smaller service sector compared to Sri Lanka, but the industrial sector is growing quite fast. The Sri Lanka, whereas we are basically based on services, and when this kind of a pandemic comes, when restrictions come, particularly the COVID curfew and all those things, economy totally derailed because the people lost employment and there was no opportunities to earn. The daily wage earner was lost, but still, many countries where having the pandemic, industrial countries continue to open their factories with restricted conditions. So this is a thing that we also have to learn in Sri Lanka. Also, too much of dependence on service sector is not going to be a healthy thing. The same thing happened to Maldives because they were basically on tourism. Their economy was on tourism. Same in Sri Lanka. We were largely depending on tourism and other service sectors. Now, when it comes to post-COVID situation, because we have to take the baseline into account, many countries already had a learning poverty component in the system because many people could not. I can remember a study done in India, for instance, that after 3 years or 4 years of schooling, there was a large number, around 40% of children in India, in particularly rural areas where, the weaker communities, that children could not read 2-3 words at a stretch, even after 3 years, 4 years of schooling. That was not the case in Sri Lanka. In that study, actually, we found that Sri Lanka had this situation much less than in other countries because our literacy rates are actually more than literacy. Sri Lanka is an educated country where, young mothers who send children to school today, if you take them, at least 85% of them have completed at least junior secondary 11 years of schooling. So these are healthy things, and these are things that we need to take into account because when a pandemic comes, just like that, the Professor Lin from Hong Kong, her presentation was fantastic in my thinking. What she was telling is that, it is the population characteristics, the demographic matters a lot for this kind of the control of this kind of pandemic. Even in Sri Lanka, why we could curtail the first wave, second wave successfully, and even vaccination campaign successfully implemented, particularly for the first dose and the second dose, because we have a highly educated society. So the education is the strength in this. So even post-COVID situation, we still believe the retention of learning in Sri Lankan context is better than in other places. Even the World Bank study, which shows that you can read this proportion of 10-year-olds unable to read a short age-appropriate text was 53% in low in the middle-income countries prior to COVID-19, compared to only 9% of high-income countries. In Sri Lanka, the estimate is 15%. The other countries, it was 50%, whereas Sri Lanka, it was only 15%. So we are in a better wicket when it comes to better situation, when it comes to education and achievement. But we know when the schools were closed for 141 days fully, and again partially for a few more years, situation has now, perhaps we have to re-estimate because we do not know the actual situation of these things because not enough research is done. Now here is actually the situation in education. Why I say this, show this is, we all know that with the pandemic, we had to look for new avenues of learning. We are quite used to formal schooling and face-to-face teaching by a teacher to the students. This has to totally look for new avenues now. All of a sudden, overnight, we had to face the challenge. Now, when it comes to the media, so the media became very important. Sri Lanka was fortunate that in usually South Asia only about 60%, 66% televisions are available. Now in Sri Lankan homes, if you take over 90% of the Sri Lankan homes do have a television, That's a big advantage. Now, when it comes to TV, tablets, smartphones, and all these things together, again, Sri Lanka was around 90%. But we know the television is not the best best for learning. This is only perhaps, even if you take the radio coverage, even Sri Lanka, we use radio for teaching, but still, that is a weaker way of reaching children. But the most important things that the radio, smartphone, and internet, the Sri Lanka, when the COVID started, our rates were around 30, 35%, 40% was the maximum, which is, of course, is a lot better than many other countries. Like Pakistan was 13%, Nepal was around that 13, 14%, Bangladesh was 17%, and we had a fairly high rate. There again, we were better. So with this, how we manage learning is what is important now. When it comes to the educational reform work also going on, the first thing affected was the schooling. The only approach that we were left with was distance learning. I don't know why our government decided, the ministry that I am the secretary, the new government named it as State Ministry for Educational Reforms, Open Universities and Distance Learning, promotion of distance learning. There was no COVID when this title was given. This is the first time it was given. And we had we were fortunate because we had this mandate to go for distance learning promotion. So it is an interesting story if I tell. The media ministry helped us a lot. So collectively, we called all the media service agencies, including the radio, and begged for their time. But you see, it was very difficult to get time from any service provider because they had programs fully loaded. But somehow Rupavahini Corporation as a national channel came for the help, and they offered 2 channels, Netra and I channels, for Tamil and Sinhala, both media. 16 hours telecast we started, but when we say telecast started, this is not just telecast. To do that, we needed 6 television studios and to produce at least 36 lessons a day, minimum. So the health curfew was declared. There was no way of moving teachers, and the homes did not allow the teachers their mothers, or mostly our teachers are females. The homes did not want to send the mother taking this risk. So with these all difficulties, and we didn't have 6 television channels. The National Institute of Education is responsible for curriculum and dissemination of curriculum. They had only 1 studio. So we borrowed the Open University studio and another private university studio, one in Jaffna, and somehow made temporary studios and managed to telecast. 36 lessons were produced daily, actually providing food, transport, everything with curfew passes. We managed to reach the children through television because television was the only thing that reached most of the homes. Then the other important thing was we had eTaksalawa as the national digital platform, but it was never recognized like that. But government immediately gave us the clearance, and it was recognized as the national platform. And eTaksalawa, we again recorded many lessons in both Sinhala and Tamil medium, and to a certain extent English medium, and provided many lessons on eTaksalawa. So that was going on. At the same time, the children, grade 1 and 2, we were worried about them because no programs were reaching them. And I was particularly worried about it because I know these are the critical years for literacy, the basic things. So the UNICEF came handy, and Sri Lanka UNICEF helped us. Then we worked on home-based learning material and produced two workbooks actually. And with UNICEF assistance, we managed to distribute these books to every child's home we delivered it. So we facilitated in various ways. Schools found various ways of putting teachers to facilitate this process. So then the critical thing was, GCO level, A-level examinations were there, and there was no way to conduct them. When the first wave was came under control, immediately managed to keep the two examinations. These are public examinations. A lot of people are waiting for these things to happen. So that was another big success story, during the pandemic, how we managed to conduct the whole examinations. There were shortcomings, but we were very happy that, the children could sit for it. The most important thing is the tremendous progress that we achieved in distance learning. Today, that NASSL, our national platform, it also has the learning management system as well. By now, over 5 million hits we get every day. There are over 90,000 lessons from grade 1 to grade 13 in Sinhala, Tamil, and English medium. So this is a huge achievement. Now actually, as a result of COVID-19 pandemic, our future is better. Now actually, with the new curriculum reforms, we are going for blended learning. We are not just going for teacher based teaching. We are trying to deviate from that and go for blended learning, mixture of many ways of learning. So that activity is taking root and making further progress very well. Actually, right now, we are planning to, during this COVID period, still we are under a threat. We are now developing teacher training material to train all our school teachers on blended learning mechanism. And we are using NASSL as well as other digital media to reach all teachers. What has happened today is actually, I presented to you earlier that we had only 40% internet coverage. This expanded. Now it has at least near 60% coverage is there, because people are seeking for it, and service providers, ICTA particularly, as well as the TRC, Telecommunications Regulatory Authority. There were certain personalities who really went out of the way to help this situation. I'm also showing you these NANSL centers. These NANSL centers are actually, if you remember, there were places, there were no signals, and children were climbing hills and up to the trees, up on the trees to get signals. That now it doesn't. Now nobody talks about these things. The reason is, with the help of TRC and ICTA, we did the mapping of all the places where there was no telecommunication, internet connections, and accordingly we set up over 3,000 NANSL centers with 10 tabs. Free for children can come to those centers and study. So we appointed one teacher to manage that center, and those centers actually allocated time to students as the demand comes. So these things help a lot to take internet to the village. Then also the Guru Gedara program that on the television, we have now grade 1 to 13, 80,000 lessons. These on iChannel and Channel Netra on Rupahini. Beside that, all other television service providers, the Swarna Vahini, then Siyata, all these channels came and offered few hours of education for various grade levels. One selected mathematics, the other one selected science, some selected primary, ITN selected primary. Like that, various people joined the process of giving education on digital media. Now, actually, what is good thing has happened as a result of these ventures. Now, the Ministry of Education, our ministry has television streaming hub established, where all TV programs for education channels are distributed centrally, standardizing all those things and approving those lessons by the NIE. Then only we give it to television channels. That is standardized. Actually, that streaming hub, establishment of a streaming hub was a big milestone. We have all these young graduates working there, and that works quite well. So apart from that, the dialogue television service providers now has given us 8 dedicated channels for education. And by next month or in 2 months, we will have 2 more channels. So we'll have 10 dedicated channels for education alone. So these are all you can see on dialogue. They go as NASSL channels. And this will be another breakthrough. Even the pandemic comes again, we are better prepared for it. At least we can reach most of the homes to teach by television and e-Taksalava. Then also there was other private service providers. They were also offering various lessons on TV and radio and various other channels. Then the lost learning during the school closure was another issue that we all know. This is a worldwide issue. UNESCO had been talking about it. UNICEF was talking about it. And we, before even they mentioned it, we, together with NIE, our ministry prepared a 100 days learning recovery program for all schools in Sri Lanka. And that is being implemented even now. This will be completed at the end of March. Only we will start the new school year in April. We also prepared home-based learning packages. This is all distributed to all schools. This is actually for children to take it home and do self-study. These are very interesting packages. A lot of creativity came from teachers. Many teachers participated of preparing these things. This is already distributed and it's going on in schools. And that was a good experience for us because we know that now self-learning, preparing self-learning material is a very important step in the educational reforms, because we are not, as I said earlier, we are counting on blended learning mechanism. We are encouraging self-learning because it is important under any circumstances. The child should be able to learn by himself or herself, and the material should be prepared in such a way to facilitate that process. So we have very good set of teachers, over 1,000, I would say, prepared for this thing. And these dialogue television channels also distribute lessons from 1 to 13, and we are quite sustainable in that manner. The educational reforms goes in a wider circle. We are starting from preschool to then administrative changes, the curriculum changes, and more important is actually school health policy has been revisited. We have formulated the new health policy, and that will be very soon submitted to cabinet for approval. So then we are also setting national schools. This is also important that actually previous speaker, Professor Lin, mentioned that the disparity in society, these 1,000 schools are actually taking care of the inequity in the education sector. Right now, there is so much of inequity in education, and that is seriously addressed. And this COVID pandemic also helped us, because now parents know that children should not travel to school 30, 40 kilometers. They should think of the school closest to their home is better, provides better security for their children. We are also working on teacher development and also making all arrangements to orient the teachers to blended learning mechanisms, online teaching and all those things, because prior to that, we didn't have any system to train them like that. We are doing all that. Now, actually, we are also trying to link vocational and regular general education together. So these are all happening through distance education mode. Distance education is reaching very high importance in the Ministry of Education. Higher education, I'm not going to touch here because actually that is done by the UGC. I'm not much worried about it also in the pandemic's terms, because they are already educated children who are in the higher learning institutes. They are self-learners. They can find learning. Instructions can be followed. I'm really critically worried about the critical group is actually grade 1, 2, 3 primary school children. If we literate them, including preschool, then that the part of the problem is resolved. So the during the pandemic, we also prepared the preschool policy. And now the country has a preschool policy. Earlier, there was no preschool policy. This has been approved by the government and the National Education Commission, and the cabinet approval has been given. Implementation plans are already prepared, and this is the good thing that happened during pandemic. We did a lot of desk work there to prepare for our changes. Then similarly, educational administrative reforms, a lot of desk work is done, and now they are being implemented. We have made good progress in all educational reforms programs, and I'm happy to say the COVID disturbed a lot of things, but a lot of desk work was done during this period. And as the new online working culture also enabled us to work together for a day. Sometimes I have taken 5-6 Zoom sessions, long ones. Even in the night now, we work on Zoom and various other teams and various other techniques. Sri Lanka also has prepared learning management systems. We demonstrated recently that from Colombo, you can teach to any school in the country once the learning management system is established. Already we have established this new learning management system for 250 schools. Our target is to give every school the internet facility by the end of the year 2022. And blended learning will be introduced. And we believe that, not handling how we did during the pandemic, but how prepared are we for in case of another situation or similar pandemic in the educations, and how education will be conducted during such a period. So I think I have taken the time, so I will stop here, and thank you very much.
Thank you, Dr. Sedara. Heartening to note the kind of work that we have done during the COVID, and such a great deal of information in your presentation on the work done in the education sector during the pandemic, which many of us were not aware. And thank you. We have time for a few questions. The first question actually relates to whether the school closure days has a relationship to the country population. Do you have any information?
Actually, I mean, I can just give a guess answer, but we have not done enough research on these topics. Actually, we should look into these things. Actually, how the demographic features. What we can say is actually definitely Western province was closed longer because the density of population in Western province is very high.
So density is really rather than
Western province was closed longer.
Right. I like to ask Sujata Gamage, who has a question. Can you hear me, Sujata?
Yes, I can.
Please go ahead with your question.
Yes, thank you. Actually, I think Sri Lanka, compared to the region, we always do well. And I think we have an extensive school system. But my one issue is when we hear this data, it's always the supply side. It's from the ministry. Ministry has done this. But what we lack is demand side data. Demand side, that's from the user's point of view. For example, TV programs. Do we know how many, what percent watched, and how effective it was? Sort of surveys we did show that TVs is not really a good way to teach our children, because children need a teacher's intermediary, and without a teacher, students are not going to sit in front of the TV and learn. So I think the demand side data is something I would like to ask Professor Sedara, because we did a household survey in India, and we mean in Learn Asia, and the numbers are correct. 85% of the students receive some services, but putting internet, the mode as mode is, we don't know we actually know about 50% received through smartphones and 30% by physically getting the documents and things like that. So we need more demand side, and I think it's hard because if the ministry asks the teachers, they're not going to schools, they're not going to give the correct data. So an independent entity has to do that. Another thing, and then I think the other one is outcomes. So my question to Dr. Sedara is, do we know how many students came back to school, the school census? Because there's UNESCO, everybody says, there's people have just permanently left school. And the other one is, do we have a diagnostic, which is very easy to do? We do these national exams, a diagnostic on basic essential learning outcomes for each grade. I think that tells us best, not from the process data, but at least outcome data from the demand side, the user side. So my question is, would it be possible to very quickly say what % of our children have come back to school?
Sujata, thank you. Thank you.
Yeah.
Sujata, thank you, and very valuable questions. You're very right. I mean, the Sri Lankan system from curriculum to delivery is a centralized administrative model. In education, it's not only in Sri Lanka, it's the same in Bangladesh or Pakistan, India, the South Asia, all countries have education administrative model. This actually, it is very difficult to go away from it. Even though I am concerned of it, you are concerned of it, changing a system is very difficult because the people also have to change with it. Most of the education systems in other countries are demand driven. It is becoming so in Sri Lanka. That is why more international schools are coming up. Parents are seeking education the way that they would wish to have it. But many countries now, even take less developed countries in Africa, today they have a more demand driven education system because even their textbooks are selected by the school. The parents demand various things. We cannot do that. Our people still expect all books should come from the government. It is, it's a long culture, which is very difficult to change. But you are very correct. I share your thoughts the same way because I don't have any ideological battle with you because I also believe that it should be more demand driven. But during the pandemic, in a way, centralized system helped us to deliver goods faster. Because the demand to come, facilities should be available equally everywhere in the country, which is not in the case of Sri Lanka. Because the Western province and urban sector do have the service providers to some extent. But in the rural areas, the schoolhouse is the only place which provides education. Very rarely other things are there. Even the internet cafe is not there. So from that side, we were handicapped. The outcome, the learning, the diagnostic thing that you asked, we have now commissioned a study. It is going on by the Ministry of Education, and I have not seen any results yet. But we were worried about what is the percentage of underachievers now. I'm sure it is increased. There is no doubt because the education and socio-economic status has a very close link. So the people in affluent homes, their parents somehow look after their children. So studies have been done by UNESCO. Some families, they indicated their children learn better or more, about 5% during the COVID pandemic because, they could provide the services. But I'm sure the same story is there for the lowest socioeconomic people. I'm afraid that, even some children may have even dropped out. But I told you that we have not done any research. Next school census will indicate to us. Not a full answer, but that's the reality. That's the actual status.
Thank you, Dr. Sedara. Because of the time constraint, we have to take this to a close. And I like once again, thank you for your effort and for the time in spite of your very busy schedule. Thank you, Dr. Sedara.
Thank you very much for the organizers all. It was a lovely conference. Thanks.
We now move on to 4 thematic presentations under education. The first one is titled "Enhancing Contemporary Teaching Skills to Address the Changing Role of Teachers Due to Long-Term Social Impacts of COVID-19 Pandemic." by K.M. Vidhana Patirana and Sandra Hammer, and will be presented by Sandra Hammer.
Good afternoon. My name is Sandra Hummer, and I'm a professor at the Institute of Educational Sciences in Graz, Austria, and the project coordinator of the Erasmus Plus project Contessa. I want to start by thanking the National Academy of Sciences of Sri Lanka for the opportunity to speak about this important topic and to share our project and our research results with you. Today, I'm going to talk to you about the digitization of higher education and its unprecedented rise during the COVID-19 crisis. COVID-19 has presented many higher education teachers with the challenge of offering their lessons digitally. As recent studies have shown, the majority of higher education teachers were largely unprepared to make the shift to online teaching when the COVID-19 pandemic began and had difficulties adapting to new teaching methodologies, modifying their course structure, arranging attractive digital learning environments, assessing student progress, keeping students motivated, and engaging them online in a meaningful pedagogical way. Higher education students faced challenges as well. Due to teacher time constraints and the lack of face-to-face engagement, students have received less personalized feedback and fewer assessments of their individual work, thereby providing them with a low level of understanding of their learning progress. They also face multiple learning formats designed by teachers who have not been trained in online course design. These findings show that pedagogical practices have been greatly affected by the advancement of science and technology during the pandemic. But digitization is not the solution in itself. We need to invest in digital teacher training even more than before. We have to foster equity and inclusion also in virtual arrangements. We have to apply digitization in a learner and target-oriented way, explore the requirements and risks of various learners, and provide teachers and students with the right tools. Contessa is an Erasmus Plus project funded by the European Commission's Capacity Building in Higher Education branch. The intent of this study was to analyze the potential of Contessa to fulfill the needs of teacher education at present, especially in the post-COVID-19 context in Sri Lanka and in general in Asia. The project development was done by the University of Graz, Technical University of Dresden, the University of Colombo, the Open University of Sri Lanka, the University of Cambodia, and Panasastra University of Cambodia. For the purpose of this study, a qualitative content analysis was conducted in order to investigate the potential and impact of the new teacher education program provided through Contessa. The content was analyzed using grounded theory methodology. Since digitization is not a solution in itself, the project design was guided by rather pedagogical than technical questions, such as what is the potential for and impact of the new teacher education program provided through Contessa? Which types of content and forms of instructional design are needed to meet the challenges of teaching and learning that might continue in the post-COVID-19 context? What skills do higher education teachers need to leverage the current and emerging challenges and to enhance their professional practice in face-to-face, hybrid, and digital environments? Contessa integrates lessons learned from the past 2 years in which the educational system needed to adapt to the new pandemic-related requirements. It provides approaches to learning and teaching with a wide range of didactic methods, target-oriented and learner-oriented planning, examples of how to establish concrete life-world references and real case studies, and videos of classroom situations, self-reflection, and individual professionalization processes. These requirements have been integrated by the use of two elements, the train-the-trainer workshops and a teacher training e-course. Now I will speak to the details of each element. The train-the-trainer workshops supply teacher trainers with the skills and information needed to transfer knowledge to teachers and trainee teachers. To arrive at a more modern form of teacher education, including virtual arrangements, teacher educators as one main target group must be addressed. A comprehensive train-the-trainer program allows teacher educators to become acquainted with contemporary educational theories, approaches, and methods. The workshops include the following topics: planning, teaching, and learning for student teachers, enhancing pedagogic professionalization processes, supporting individual student development, mentoring, assessing student learning, and trainer tutorials. 5 online modules serve as a comprehensive teacher education program for the achievement of contemporary teaching competences. They contain key elements that aim to improve the teaching skills of student teachers. Upon completion of this course, participants will be able to implement newly acquired contemporary teaching skills, engage students in classroom activities, and learn new ways to help students reach their full potential. The 5 online modules are Building Blocks of Primary Education, Excellence in Teaching, Profession-Specific Competencies of Primary School Teachers, Learner-Centered Primary Education, Enhancing Co-Created Learning Processes, Embracing the Differences, Pedagogic Approaches to Diversity, Heterogeneity, and Special Needs, and Digital Teaching and Learning. In the investigation of the potential and impact of Contessa, a number of categories emerged, such as communication, presentation and media competence, creating learning arrangements, accompanying individual learning processes, making life-world references, enhancing the ability to engage, and also the ability to empower. I will now touch on the main focus of each of these impacts. One of the central research outcomes substantiated with Contessa is that teachers are systematically guided on how to explain things in a clear and concise way and to take into account the relationship level to the learners. Presenting information illustratively and effectively, also in virtual learning environments, is treated as a key skill in getting your message across and therefore considered as fundamental for distance learning. The analysis revealed that teachers should acquire knowledge regarding methods of creating stimulating teaching learning settings in terms of spatial and also social arrangements, also in virtual environments. The involvement of learners in virtual environments who are not considered as receptacles of knowledge, but of individuals who create their learning actively and uniquely, is considered as one of the most fundamental potentials of the Contessa program with long-term effect on education. An effective teacher is always a mentor and accompanies individual learning processes. Contessa acknowledges the consideration of learning difficulties, individual learning conditions, developmental requirements, as well as learning motives and how they can be considered in classroom situations. Making real-world connections and referring to the life concepts of the students is important in achieving comprehension-oriented learning processes. Ways to make life world references are addressed in the theoretical and practical approaches of the Contessa modules, which is also considered indispensable for successful in-person as well as remote teaching and learning scenarios. Contessa introduces various paths for teachers to find engaging resources and materials for learners, allowing them to acquire comprehensive and deep knowledge. Formulate target-oriented assignments and opt for methods allowing the students to develop skills and competences in an individualized and differentiated way. Teachers acquire the ability to empower students to think critically, innovative, creative, adaptable, passionate, and flexible. They learn to encourage them to be able to solve problems, self-direct, and self-reflect. To sum up, the qualitative content analysis of the Contessa program yielded the following results. Contessa delivered a step change in the development of critical skills, knowledge, and competences to provide the foundations for participation in work and society. Improved the transition of learners at critical stages in the education and training system. Increased the use of ICT in teaching and learning as flexible learning paths for individual development. Improved the learning experience and the success of learners. Assisted at-risk learners or those with special educational needs. Developed the progress of learners with migration backgrounds. So it can be concluded that the approach developed through Contessa has progressive features to address the long-term effects to teacher education. Thank you so much for your interest in this project and in our project results. Please visit our website for further updates and access to our program.
Thank you. Thank you, Sandra. We will actually take the questions at the end of all 4 presentations because time constraints. The next presentation is on a study of the adaptive expertise among lecturers in University of Peradeniya, Sri Lanka during the COVID-19 pandemic, and will be presented by Umanda Gane. Can we keep it to 10 minutes, please, Umanda?
Today, I'm going to present my research study under the topic Study of the Adaptive Expertise Among Lecturers in University of Peradeniya, Sri Lanka during the COVID-19 pandemic. I am GWD Ganegoda from Department of Nursing, Faculty of Allied Health Sciences, University of Peradeniya, Sri Lanka, and my journey was guided by Professor J.A.C.K. Jayawardena from Faculty of Dental Sciences, University of Peradeniya, Sri Lanka. These are the areas that I'm hoping to cover throughout my presentation. Before I proceed, let me share you some information. As we all can sense, the complexity of each and every working environment is getting increased day by day due to the convoluted needs and demands of the population. And what happened with the COVID-19 pandemic? The evolution process got drastically triggered. In early period, Sri Lanka was well recognized for the successful management against the COVID-19 pandemic. But what happened? We have to face several lockdown periods after that. One among many reasons behind this unfortunate failure could be the inability of Sri Lankans to get adapted to this new normal situation. Therefore, we have to reach this term, adaptive expertise, or people's capability of successful adaptation to novel and non-standard situations to have a successful survival against these upcoming unexpected challenges. The concept of adaptive expertise was firstly introduced by Hatano and Inogaki in 1986. According to them, adaptive expertise has 2 approaches: routine expertise, or where the individual performs best only in routine or standard situation, and adaptive expertise, where the individual can perform best in both routine or standard situations as well as novel or non-standard situations. According to Ball, Carbonell, and other authors, adaptive expertise has three dimensions which influence it: domain-specific skills, metacognitive skills, and innovative skills. Domain-specific skills can be simply described as the broad content of knowledge that an individual possesses related to a particular area or a field. Metacognitive skills is about the awareness of what we know and what we don't. Simply, it is thinking about thinking. Finally, innovative skills is about creating novel solutions or answers to the arised problems. A recent study conducted among university lecturers in a European university by Jayawardena showed that domain-specific skills and innovative skills have a significant contribution to the level of adaptive expertise, but the contribution of metacognitive skills remained quite unclear. Furthermore, she suggested that there could be other dimensions, such as personality traits, behind the level of adaptive expertise. Therefore, this study aimed to explore the dimensions of adaptive expertise of university teachers at a Sri Lankan university in the context of COVID-19 pandemic. The specific objectives were to explore the dimension of adaptive expertise of university teachers, to investigate the level of contribution of each dimension for the adaptive expertise of university teachers, and to measure the level of adaptive expertise among lecturers at University of Peradeniya in the context of COVID-19 pandemic. When moving into the methodology, this was a descriptive cross-sectional study where it was conducted in University of Peradeniya, Sri Lanka. Convenient sampling method was used. Permanent lecturers were included, whereas temporary visiting lecturers and lecturers who were study leave were excluded from the sample. The modified pre-tested expertise inventory, which was used by Jayawardena, used for the data collection purpose. When collecting data, firstly, the ethical clearance was obtained from Ethics Review Committee of Faculty of Allied Health Sciences, University of Peradeniya. Then permission was requested from relevant faculty deans. The online survey link was created by using Google Forms, and it was sent via personal email addresses. The consent was taken prior to the data collection, and data was collected anonymously. The data was analyzed by using statistical package for the social sciences, descriptive statistics, KMO and Bartlett test of spuriosity, exploratory factor analysis, along with rotation strategies, and Kornberg's alpha tests were performed. Now let's see the results of this study. In considering about the demographic characteristics of the study participants, total study sample consisted of 151 lecturers. The majority of were female lecturers. Response rate was calculated as 19.26%. In considering the response rate with regard to the Faculty of Science showed the highest response rate. Demographic characteristics according to the academic positions reveal that the majority of the participants were senior lecturers grade 2 and least number of participants were senior professors. The data were tested for the sample adequacy, and the results proved that the present sample was appropriate for factor analysis. Therefore, factor analysis was proceeded with rotation strategies. 4 factors were identified, and each 4 factors and the total tool were checked for Kornberg's alpha value. An alpha value for each factors or dimension, and the total tool showed a higher reliability value. Then the scores were calculated for adaptive expertise and for the other dimensions. Adaptive expertise score was calculated as 4.40, and when considering about other 4 dimensions, the highest score was recorded by domain-specific skills and the lowest score was recorded by personality traits. So let's discuss these results. According to the calculations made, of this study, the highest score that could obtain for the level of adaptive expertise was 5 points, and the total sample showed a value of 4.40. Thereby, we could say that the university lecturers were adaptive to a higher degree during this COVID-19 pandemic period. And their adaptive expertise level was comprised of 4 dimensions. The personality traits was identified as the new or the 4th dimension. According to our view, personality traits could be the internal characteristics of the individual that can motivate the process of adaptation, that can keep the individual adhere to the process of adaptation. Sometimes it could encompass other 3 dimensions as well. To reach a definitive conclusion regarding the contribution of personality traits, further studies should be conducted. The highest contribution to the level of adaptive expertise was shown by domain-specific skills. Thereby, we could say that the broad content of knowledge that university lecturers were possessing were the main reason behind their higher level of adaptive expertise. Similar results were obtained from Jayawardena University as well. Innovative skills also showed a remarkable contribution, and similar results were obtained from Jayawardena's study. As expected, metacognitive skills also showed a considerable contribution. Therefore, we can say that the present study has adequately covered the aspects of metacognitive skills. When concluding the findings of the research, that we can say university lecturers were adaptive to a higher degree during the COVID-19 pandemic period, and personality traits identified as the 4th dimension of adaptive expertise among university lecturers. To obtain a definitive conclusion, further studies should be conducted regarding the contribution of personality traits. These are some of the references that were aided in this research study, and I would like to thank you all for participating in this presentation.
Thank you. We now move to the next paper, long-term social impact of COVID-19 pandemic on teaching and learning, from India, presented by Anshu Bhadravaj.
Good afternoon, everyone. In this international webinar on long-term social impact of COVID-19 pandemic, I, Dr. Anshu Bhadravaj, Skill Associate Professor, Shri Vishwakarma Skill University, Gurugram, along with my co-authors, Dr. Vikas Chaudhary, Professor Management, Department of Humanities and Social Sciences, NIT Kurukshetra, and Dr. Deepti Sharma, Assistant Professor English, KVA DAV College for Women, Karnal, would be presenting on long-term social impact of COVID-19 pandemic on teaching and learning in context of India. India is the second largest populated country in the world with a high density, and even the transmission potential of COVID-19 was very high. There has been adverse impact on the livelihood of people because of closure of economic activity, and impact of lockdown in terms of social aspect could be widely seen in various sectors, including education sector. There is a wide range of response all over the world to contain the spread of COVID-19, and various measures are adopted like lockdown, but there have been wide variations in the stringency of the lockdown also in various countries. Though India has a young population, as per one of the survey, with only 10% of the people are above the 60 years of age, which is also significantly higher than other countries. Given this diversity in India, the management of COVID-19 within states in India depends upon the population density, demographic aspect, and certain other factors which is being considered by the policymakers. The present study focuses on the long-term social impact of COVID-19 on teaching and learning in context of India, and policies and strategies adopted for limiting the spread of the pandemic that has adversely impacted the education sector. The higher education institutions are incorporating the skill component in the curriculum and aligning to the industry requirement that results into enhancing the workforce productivity by creating such skill ecosystem which is providing outcome-based learning and training. Shri Vishwakarma Skill University has also taken a lead to enable pathways for learners by offering skill-based programs that are mapped to the employer demands and benchmarked to the global standards. Such institutions are bridging the gap in their knowledge and creating employment opportunities by leveraging the strength and capabilities. The industry integrated model has focused on delivering quality courses and providing skill development and on-the-job training, thus promoting academic excellence for the learners. Even the government and the various apex institutions like UGC, ICSSR, DST have also come up with several new schemes and programs to facilitate the promotion of excellence in the higher education and research. Even to strengthen the economy and higher education institutions and to reduce the impact of COVID-19, such initiatives are imperative to provide scientific training and skilling of the youth. The emerging challenges due to this unprecedented situation can have long-term social impact on teaching and learning and may be addressed by integration of knowledge and technology. During this period of COVID-19, the policy planners have focused more on research, education, and institution building by framing the strategies and policies to enable the higher education institutions to adopt such practices so as to enhance the teaching and learning experience. Faced with this unprecedented pandemic and the resultant uncertainty, there has been disruptions in supply chain, not only at the local level, but also at the global level. This in turn also has some long-term social impact, and various higher education institutions are adopting digital platforms and innovative technologies to enhance the learning experience. The ongoing COVID-19 pandemic has helped showcase the role of technology-enabled platform along with digitization for disseminating the knowledge to the learners. Even the empirical evidence and the vast literature also suggest that there is a great role of innovation and technological progress in growth and development as a whole. As per Global Innovation Index, India ranks 48th among 131 countries in terms of innovation, performance, and India has also entered the top 50 innovating countries for the first time in 2020. As per Economic Survey 2021, India has significantly improved in HCR, that is human capital and research performance, from rank 103 in 2015 to 60 in 2020, and this improvement is attributed to improvement in tertiary education subpillar. Over the next decade, the years that lie ahead will shape the destiny of the whole world, and not just India, through provision of high quality educational opportunities. The new Education Policy 2020 is a new and forward-looking vision for India's higher education system towards more holistic and multidisciplinary education. Even there is a lot of transformation in the knowledge landscape around the world due to emerging technologies and advancement in the field of education and information technology. India has emerged as a global knowledge superpower because of the education system that has been rooted in the Indian ethos in ancient times, in the world-class institutions like Takshila, Nalanda, etc., and also produced great scholars. The long-term social impact on teaching and learning crisis due to current situation can be dealt by revamping the curriculum and pedagogy. Thus, NEP 2020 focuses on developing the mechanism to deliver high-quality higher education with equity and inclusion, and also to increase the gross enrollment ratio in higher education, including vocational education, from 26.3% in 2018 to 50% by 2035. Thus, higher education institutions must adopt more holistic approach in an integrated manner, focusing on application-based, having learning-centric approach, and there is a need for skilled workforce, multidisciplinary learning, collaborative research to deal with the present situation, having social impact on teaching and learning in different fields of study. Faced with enormous uncertainty, the lockdown had an inevitable impact on various sectors, educational system, and on the economy as a whole. Focusing economic recovery, the government has announced relief packages, development and welfare schemes that has enabled the country to endure the impact of COVID-19. The same is depicted in the trends in social service sector expenditure by general government, that is combined central and state government. The table depicts the total budgetary expenditure from 2014-2015 onwards, and the amount which is being represented over here is rupees in lakhs and crores. So from this table 1.1, which is being shown over here, it can be interpreted that considering the importance of social sector, the government has also increased the expenditure on social services. That includes education, health, and other social sector by center and the state combined together. And in this particular table, we can see the expenditure on social service, and out of which on education from the total budgetary expenditures can be seen. This table depicts the expenditure on the social service, out of which on education as a percentage to GDP, and this is being increased from 6.2% to 8.8% during the period 2014-2015 to 2020-2021 as per Economic Survey 2021. So in context of education sector, it has also increased from 2.8% in 2014-15 to 3.5% in 2021. This table depicts the expenditure on the social services, out of which on education as a percentage to total expenditure, and the data which is being depicted in these tables are being taken from Economic Survey 2021. The pie diagram represents the expenditure on education as percentage to social services, representing the time period from 2014 onwards. Given the uncertainty of COVID-19, the new policy paves the way for transformational reforms in higher education system in India by focusing on quality education and learning outcome with emphasis on the 2 Ps, that is teacher and technology. To enhance India's economic growth, investment made in social infrastructure played an important role for improving socio-economic indicators and achieving the sustainability development goals. The skill development sector helps in enhancing the employment opportunities and realizing self-reliance through Atmanirbhar Bharat Rojgar Yojana. To address the challenges faced in this unprecedented situation, higher education institutions and the skill development universities are online digital teaching. The global pandemic has caused radical changes in education, and higher education institutions manage this transition by shifting to virtual teaching. Still, there is a need to invest in digital infrastructure and adopt best practices to strive for excellence in hybrid learning. To face new challenges and opportunities, reskilling and upgrading faculties are the need of the hour. Thank you.
Thank you. Now move on to the last paper, Lifestyle Changes During COVID-19 Pandemic Among Medical and Physiotherapy Undergraduates in the Faculty of Medicine, University of Colombo. Will be presented by Ms. M.D.S. Pramodin.
Good morning, everyone. Our study was on lifestyle changes during COVID-19 pandemic among undergraduate medical and physiotherapy students in Faculty of Medicine, University of Colombo, Sri Lanka. So as you all know, COVID-19 pandemic has become a public health burden worldwide. Not only the disease itself, but also the social distancing measures and related lockdown have led to several physical and psychological problems in many individuals. The pandemic has led to drastic changes in lifestyle of people at all ages. Among them, youth is a vulnerable population to change their lifestyle either towards a positive direction or towards a negative direction. So during the pandemic, online classrooms and working from home became the new normal, leading to many difficulties in achieving the recommended levels of physical activities. Some studies have reported even in the non-pandemic period, university students were prone to unhealthy lifestyles and unhealthy dietary patterns. So this is even more common in medical and physiotherapy students, as they are already known as a risk group for physical inactivity and sedentary behaviors due to their tight academic schedules. Some studies have reported during the lockdown, there is an increase in sedentary behavior, a reduction in physical activity levels, and a stronger tendency to eat unhealthy diet. Therefore, the objective of our study was to identify the changes in lifestyle and physical activity levels during the COVID-19 pandemic among undergraduate medical and physiotherapy students. Another objective was to identify the gender difference in physical activity levels and sedentary behaviors. Speaking of the methodology, this was conducted as a descriptive cross-sectional study, and we used convenient sampling to recruit participants. Sample size was 349, including 141 males and 208 females. Study population were undergraduate medical and physiotherapy undergraduates in Faculty of Medicine, University of Colombo, Sri Lanka. An ethical approval for this study was obtained from the Ethics Review Committee of the Faculty of Medicine, University of Colombo. Statistical analysis was done using the SPSS version 25. As study instruments, we used the lifestyle-related behavior questionnaire to assess the changes in lifestyle. This consisted of 20 questions which asked about the changes in nutritional level, the changes in sitting and screen time, stress and anxiety levels, and the quality of sleep and hours of sleep. To identify the physical activity levels, we used the short form of the International Physical Activity Questionnaire. According to that, we classified physical activities into 3 groups as vigorous physical activity, moderate physical activity, and walking. So in the figure 1, it shows the changes in dietary patterns during the COVID-19 pandemic, and participants had to respond according to a Likert scale ranging from significantly increased to significantly decreased. Majority of the participants responded that there is a decrease in the consumption of junk food during the pandemic when compared to the pre-pandemic period. On the other hand, majority of the participants responded that support of family in eating healthy, intake of immunity-boosting foods, daily intake of fruits and vegetables, and habit of snacking between meals were slightly increased during the pandemic. This graph illustrates the changes in stress and anxiety levels, hours of sleep, sitting and screen time during the pandemic. Majority of the participants reported that their stress and anxiety levels and hours of sleep were slightly increased. Interestingly, 239 participants responded that their sitting and screen time was significantly increased during the pandemic when compared to the pre-pandemic period. This pie chart shows the level of physical activity among undergraduate medical and physiotherapy students. And you can see that 50% of the participants were physically inactive, while only 9% were highly physically active. Total metabolic equivalent minutes per week according to the gender is shown in this image. The metabolic equivalent minutes is defined as the energy that is expended while we are doing physical activities. So 1 MET is equivalent to the energy that is expended while we are at rest. Male participants had significantly higher MET values when compared to female participants. Physical activity level according to the gender is represented in this graph. As I mentioned earlier, we classified physical activity levels into 3 groups as vigorous, moderate, and walking. And according to the American College of Sports Medicine, we considered vigorous physical activity to be equivalent to 8 METs, moderate physical activity to be equivalent to 4 METs, and walking to be equivalent to 3.3 METs. Male participants had higher physical activity levels in all 3 categories, but there was a significant difference only in the vigorous physical activity levels. We identified the sedentary behavior according to the sitting time, screen time, and sleeping time. But we did not find any gender difference in sitting time, screen time, or sleeping time. So our study identified changes in lifestyle during the pandemic related to dietary pattern, stress and anxiety levels, hours of sleep, and sitting and screen time among undergraduate medical and physiotherapy students. Also, majority of the participants were physically inactive during the COVID-19 pandemic. Studies conducted in Spain, India, and Italy has also reported similar findings. Some studies reported that prevalence of overweight and obesity has also significantly increased, especially in the youth during this COVID-19 pandemic. Therefore, the pandemic could be seen as an opportunity to implement new habits leading to an active lifestyle. In conclusion, there is a need of promotional educational strategies to promote indoor physical activities and active lifestyle behaviors, especially during online classrooms among medical and physiotherapy undergraduates during the COVID-19 pandemic. So this would be beneficial in managing secondary complications associated with physical inactivity and sedentary lifestyles. So these are the references. Finally, I would like to thank Dean and the academic staff and the undergraduate students of the Faculty of Medicine, University of Colombo, for their support given during the study. I would also like to thank all the organizers of this online conference for giving me this opportunity. Thank you very much.
Thank you. I do not see any. Yes. Is Manjula Vidhanapatran available online for a question on ED1?
He's not available.
Sorry? Not available? All right, there's a question for Anshu Bhardwaj. Question is in relation to transition to online teaching. What in addition to the points that you mentioned, but there are specific points that related to inequity, the poor against rich, not so. Anshu?
Yes, sir. Yes, sir.
Yeah.
Sir, can you please repeat the last line?
No, the question is that in relation to the transition to online teaching and these digital platforms, was there, what was any experience on these inequities in relation to people who could afford or those who are poor? Do you have any information on that?
Yes, sir. Here I would like to talk about in context of India, like I
yes.
already mentioned, that the need of the hour is to invest in growth multipliers like education, health, and equal opportunity. And the need is that the attention needs to be given from the grassroots level through digital university and multilingual course initiatives for skilling, and also creating such ecosystem that is focusing on the new age skills which are in demand, and also creating job opportunities. So in this regard, I would like to mention the Union Budget 2022, which is recently being announced, and it has focused on digital driven progress and also emphasize upon realizing the self-reliant vision of India as a whole. And it proposes to set up 750 virtual labs in science and mathematics, and some 75 skilling e-labs for stimulated learning that will help create such kind of truly employable talent base that will contribute to the digital dividend. So this will be basically backed up by the digital ecosystem. And in this, I would like to add some data also here with regard to the total outlay that was allocated for schools was 63,449 crores, and that was compared to rupees 54,873 last year. And if we talk about higher education also, even the amount which is being allocated in context of higher education is somewhere around 40,828 crores as compared to last year. So that is how we can see that the education sector as a whole is witnessing more positive and dynamic shift. So
Thank you. Yeah, thank you. There's one more question which perhaps is can be both can be sort of responded by both Umanda Ganegoda and Pramodini. The findings on findings from your study at the University of Peradeniya and the University of Colombo in relation to lifestyle changes and adaptive expertise. Can you develop, or have you developed any kind of recommendations to the university system or UGC? Either Umanda, both, or Pramodini. Are you there? Hello, Umanda Ganegoda?
Yes, I'm here.
Yes. Did you get the question?
Yes, I got the question. So about the recommendation, so as we find out a new dimension regarding the adaptive expertise, so we thought that we discussed that there should be several studies conducted under this dimension. So because that might be one reason that the undergraduates are less creative and they are more dominant in the domain, because they are more law in their personality traits. So we thought that the curricular activities and those academic performance should be little much more directed towards to developing the personality traits of the individuals and undergraduates. So thereby we could motivate them to to face these kind of challenges in the future with more effectively, and by enhancing this personality traits dimensions other than developing the domain knowledge and other dimensions.
All right. Any response from Pramodini in relation to any particular recommendations, either to the University of Colombo Medical School or to the UGC?
Yes, sir. So at the moment we have not developed, but
right.
Yeah, we are hoping to.
All right. Thank you. Thank you. In the absence of any further questions, do the panelists have any questions to raise? All right. In the absence of any other questions, I'd like to invite Priyan Dias for a short presentation on one of the projects that the Academy and Professor Dias is leading for the Academy.
Okay, thank you very much. So this is actually a sort of a commercial break, in the sense that although we have an what you call it, an academic partnership with Epicenter at the University College London, they have also been supporting us financially as an academy. So I thought it was nothing but right to just highlight some of their work and their website. Actually, this is taken from their website. So if you are interested in these fields of learning, which is actually more to do with engineering, but also if you can see, they have some psychologists and sociologists associated with them, because it is an interdisciplinary research center for natural hazards resilience at the University College London. So UCL, I'm sure many of you who are listening will be familiar with UCL. So some of their areas, if you look at their website, they highlight the people that they have in terms of their expertise, the research that they do, and also the teaching. So if I can just say something a little bit about each of them, I won't say very much about their people. It is the director of the center is somebody called Professor Tiziana Rossetto. She is the person who is leading the collaboration with the academy as well. Now, this is just a brief view about some of the research that has been done in Sri Lanka. So you can see that it is research into what shall I say? Things like, of course, it's engineering research, but looking at school buildings and hospitals. So looking at that, at those sectors of the economy that would be most of greatest value for sort of social empowerment and things like that. So on the hospital study, there were 3 hospitals on the southern corridor that were investigated. And school buildings, of course, are more or less the same all over the country. But once again, it was school buildings on the coast. So this was some kind of engineering analysis on developing fragility functions for these buildings. But, at the same time, there is this kind of sociological research also that is done. This is a questionnaire survey among these school principals about the hazards that they consider to be most important. So even though it is almost 20 years after the tsunami, it is still considered to be hazard number 1 by 20 out of 25 principles. So this is just a cross section of their research, indicating that yes, it is primarily engineering research, but it is also multidisciplinary. And just as a final plug for this center, if any of you are interested in doing a master's in earthquake engineering with disaster management, then maybe the next year might be the year to change your life. Well, that's what the website says. So thank you very much. I will stop with that and hand it over back to the chairperson.
Thank you, Priyan, for that introduction. I think we will have a short break now and reconvene at, shall we reconvene at 5:30, or do you want a longer break?
5:30 is good, because everybody may be wanting to finish here.
Okay.
There's a 5-minute break there.
Right, yeah, that's a 5. Okay. We'll reconvene at 5:30. Thank you. Can we start? Hello.
Yes, let's start.
Thank you. The next presentation is on the science stream. Lifestyle among general population during COVID-19 lockdown in Nepal by Marina Shrestha, SP Shrestha, Sunil Shrestha, and SK Joshi, and will be presented by Marina Shrestha.
Hello, I'm Dr. Marina Shrestha from Kathmandu Medical College. I'm going to present on lifestyle among general population during COVID-19 lockdown in Nepal. The government of Nepal declared lockdown from March 24 to July 21st, 2020 due to the first wave of COVID-19 pandemic. During lockdown, there was restriction in movement and people worked from home. Such changes in the lifestyle caused switches in the people's behavior. Aims and objectives of the study. General objective to assess lifestyle behaviors in adults during the COVID-19 pandemic where a lockdown was implemented. The specific objectives were to assess the dietary habits, to find out the physical activity and the score, and third one to assess the stress score among general population. Methodology. It was a cross-sectional study which was conducted on August 2 October 2021. The study site was Nepalese citizens living in different parts of the country, and the study population was general population living in Nepal. The sample size calculated was 295 by using the formula Z square PQ by V square. We used a convenient sampling method, and data collection method was used through the Google form, where International Physical Activity Questionnaire, Sleep Quality Assessment, and Nutritional Questionnaire was kept. Data collection technique was through online, through Google Forms, which was sent through email, Viber, and the Facebook. Ethical consideration was taken from the Institutional Review Committee of Kathmandu Medical College. Now, the results. The results are divided into 4 groups. Part 1 describes about the socio-demographic information. Part 2 describes about the dietary habits compared with weight changes during COVID-19 lockdown. And Part 3 describes about the level of the physical activity, which was compared to weight changes during COVID-19 lockdown. And Part 4 shows the correlation between sleep qualities and the other variables. Now, Part 1, socio-demographic information of the participants. The total respondents were 295, among them 48.8% were males and 51.2% were females. 92.2% of the respondents believed in Hinduism, and 63.7% of the respondents were married. The median age of the participants were 36 years plus minus 12.09 years. The majority of the participants responded had attended the master's level of the education, and 38% of them were the service holders. And we got 82% of the response from Bagmati province, province number 3. Changes in dietary habits compared with weight changes during COVID-19 lockdown can be seen in this table. During lockdown, 34.2% consume more food quantities, and 37.3% of them had in between snacking habits during COVID-19 lockdown. An increased amount of food consumption and frequency of snacking were higher in individuals who had weight gain than those who had who reported the weight loss or had no changes. Consumption of more home-cooked meals was associated with weight gain. Table 3 shows the changes of the level of the physical activity compared to weight changes during COVID-19 lockdown. The participants who performed low level of physical activity were 30.5. Those who perform moderate level were 42%, and and those who perform higher level of the physical activity were only 27.5%. Increased sedentary behavior was reported by most of the participants, and no significant changes were seen in physical activity levels in individuals who reported weight gain compared to weight loss or no change. This table shows the correlation between sleep qualities with the other variables. The subjective sleep quality of the participants were categorized as fairly good, 45.4%. The sleep, there was significant correlation between the sleep quality and the other variables like sleep duration, sleep latency, sleep medication, and daytime dysfunction. There was a negative correlation between the sleep quality and the age. And similarly, daytime dysfunction may result due to sleep was seen from this table. This figure shows the list of the reasons why the participants changed their dietary habits. And one of the reasons was availability of more time for meals preparation. And the next one was feeling of the boredom and the emptiness during this period. Now, the discussion. Data from the current study showed that during lockdown period, the participants had change and around had weight change, and around 28.1% participants reported that there was from 1 to around 3 kg of the weight change during the lockdown. And other studies have also reported around 3 to 5 kg of the weight gain. And this can be because during this period, there was less physical exercise and people were confined in their homes. This study was demonstrated an increase in food consumption and snacking significantly among those who gained weight gain during lockdown. And this result was consistent with the previous studies which were done in Saudi Arabia, Poland, and Italy. We can give a logical explanation to this in a way that people have more time during this period, and they utilize this time by preparing the variety of the foods and tried new research. The study showed moderate physical activity during the lockdown. This was also in this result was inconsistent with the studies done in Saudi Arabia and the Cyprus, where the population had low type of the physical exercise. The subjective sleep quality of the participant in this study was fairly good, and this was similar to the study done in the Cyprus. This could be the reason that while they were in lockdown in their own homes, they found themselves safe from COVID-19. So the peace of mind has resulted in a positive sleep quality of the participants. Conclusion. Lifestyle behaviors were affected during lockdown period. The findings of the study provides the opportunity for general people to get aware of unhealthy behavior and correct timely. It also suggests government authorities and the policy makers to take some policy intervention and motivational actions so that the general people will adopt healthy lifestyles during such future lockdown. Thank you so much.
Thank you, Dr. Shestra. The next paper is Overcoming the Impact of COVID-19 Pandemic on Community-Based Blood Collections at a Tertiary Care by W.S. Fernando and Felicia Vidhanavasan and will be presented by Ms. Itanu.
Overcoming the impact of COVID-19 pandemic on community-based blood collections at a tertiary care hospital-based blood service. I am Trilisha Vitanavasa. Pandemic COVID-19 affected the community-based health services, particularly blood transfusion services globally, because blood donors are from the community. WHO declared SARS-CoV-2 infection as a pandemic in March 2020. Sri Lankan government imposed travel restrictions island-wide as a precautionary measure. It challenged to national blood transfusion service, including all hospital-based blood centers, in terms of maintaining adequate blood supply for the demand. Though SARS-CoV-2 is not considered as transfusion-transmitted infection, recruiting healthy donors, ensuring safety of the donors and staff were huge challenges. NBTS maintained 100% voluntary blood donor program, nearly 85% from mobile blood collection, and 15% from in-house donations. Dependence on mobile blood collection to fulfill the demand made the problem much severe. Travel restrictions, avoidance of gathering, fear of acquiring the inspection stopped the mobile collections completely with the onset of the pandemic. Gravity of the problem at University Hospital, Kothalawala Defence University. Being a new establishment, blood donor department started in January 2020. NBTS island-wide blood collection dropped from 444,000 to 397,000 in 2020. Colombo cluster blood collection has dropped by 24.5 in 2020 when compared with 2019 figures. Planned mobile blood collections were cancelled. Less popular in-house collections were affected more with the imposed curfew and travel restrictions. During the study period, deficit of blood collection to demand was 300%. National Blood Center supported to fulfill the demand. With the island-wide crisis, all blood centers had to implement their own strategies to overcome the pandemic effect on blood collection. The study was planned to evaluate the success of the new strategies with the COVID-19 pandemic on blood collection at tertiary care University Hospital. Methodology. This is an observational study. Blood bank statistics were used from the blood bank management system. All successful donations received during the study period were used for the analysis of data. The deferred donor statistics were excluded from the study. In-house donations and mobile campaign donations were counted separately to understand the impact of new norms imposed by the Ministry of Health. Success of the methods used to increase public awareness to promote in-house donations were assessed to the donor interviewing. Donors' responses were noted down during the counseling. The data obtained were analyzed using Microsoft Excel spreadsheets. The data were compared with the Colombo cluster statistics of annual report NBTS 2019 and 2020. These are the methods we have implemented. The responses were categorized as following. Donors who have responded to displayed posters and banners, who have responded to announcements at the hospital premises, who have responded to awareness to staff members, who have responded to awareness to social media, who have attended to online appointments, and who are the regular donors. Results. Demography. Number of males and female donors during the study period. Total number of blood donors were 1,867. Out of 1,867, 81% were male donors and 19% were female donors. This is normal in the national figures also. We have more male donors than female donors. Total blood collection, in-house and the mobile campaigns. Out of 1,867, 65% from the in-house blood collection. Only 35% from the mobile campaign collections at our blood bank. Here you can see majority of our collections during the study period were from the in-house. This chart shows the effect of COVID-19 on blood collection with the 3 waves of the pandemic. Pandemic declared in March, and then the first wave came there onwards until the October. With the new establishment, we have increased our blood collection through the mobile blood donors. Blood But as the first wave hit the country, our collections were dropped. We have implemented several strategies like communicating individually to the donors and our registered donors to come and donate. But because of the second wave, again, we were at the decline of the blood collection. With the implemented strategies like displaying banners and posters and on the screen showing, and then the announcement made during the rush hours in the hospital, our blood collection increased. Here you can see, though our blood collection increased, there are dips with the first, second, and third waves of the COVID-19 pandemic. Strategies implemented to improve donations and responses from the donors. With the strategies, the responded donors, 34% responded to the notice board and banner displayments, 29% for the announcements, 19% were regular donors, 8% came through the NBTS appointments. Donations received during the study period according to the quarters of 2020-2021. In the 3 quarters of 2020, our in-house collection were better than the mobile blood collection, but our collections were not good in the first and second quarters. With the settling of the pandemic in 2021, our blood collection were increased. Still, the in-house collections were better than the mobile blood collection. Conclusion. Though pre-COVID statistics are not available in UHKDU, total blood collection obviously affected due to COVID-19 pandemic according to national statistics. Mobile blood collection is affected more due to the strict health guidelines during the early phase of the pandemic. Strategies implemented were successful to improve the blood collection at UHKDU. The impact of the blood collection could be long-lasting if the interventions were not done. Recommendation to minimize the long-term impact of COVID-19 on blood collection. We recommend to strengthen the strategies to improve in-house blood collection as donors can be well facilitated in any pandemic situation in future. These are our limitations, being a new establishment and lack of pre-COVID data to compare with the post-COVID impact. Thank you very much.
Thank you, Trilisha. The next paper is on healthcare economics associated with COVID-19 patients in a tertiary care hospital by P.A. Rodriguez, R. Hemalata, and S. Lavanya. And the paper will be presented by R. Hemalata.
So I welcome everyone to the webinar. Our work is on healthcare economic associated with COVID-19 patients in a tertiary care hospital. Myself, I'm R. Hemalata from PhD College of Pharmacy. So COVID-19 has presented an unprecedented challenge to the world, impacting everyday living, resulting in widespread international restrictions to combat the global pandemic, and healthcare services has been severely impacted, posing challenges to delivery of care as well as to the preservation of resources and PPEs, that is personal protective equipment. The challenges of COVID-19 has resulted in reassignment of hospital beds, reproposing of personnel, and reallocations of financial resources toward care of COVID-19 patients. And COVID-19 has affected all countries in multiple ways, which can be viewed from human cost, economic cost, social cost, and several other perspectives respectively. And due to COVID-19 in a tertiary care hospital in India, crisis has raised serious questions on many issues that are strategic and have global significance. Materials and methods that we have used here is, it is a retrospective cost analysis study conducted during January to December 2020 in a tertiary care hospital located in Coimbatore, and fever clinics were set up at the COVID-19 ward, and COVID-19 risk patients and the acute respiratory infection patients were admitted in the isolation ward, and direct expenditure including cost external for the support of community COVID-19 operations were obtained from the hospital finance department. Data were identified from the hospital's electronic database, length of inpatient stay and length of stay in the ICU, number of COVID-19 tests done, and discharge status were collected. And diagnosis was confirmed by detection of viral RNA on polymerase chain reaction test of upper or lower respiratory tract specimens, and antigen testing was also available. So this schematic representation is model diagram, structure of the model of COVID-19 infection and progression, and patients progressed through a modified susceptible infection and recovered process. And suspected patients were screened for body temperature, cold, and recommended for RT-PCR test or rapid antigen test. And after the reports, the patients are admitted in isolation ward. Asymptomatic stable patients are treated, and a hospital stay of 2 to 3 days is recommended for symptomatic patients based on the severity of conditions like mild, moderate, severe. They are admitted in hospital. And most of the patients admitted in the hospital with positive COVID-19 reports were above 40 years of age. For such unstable patients, ICU conditions is recommended with ventilator aids. Mild, moderate, severe infected patients are recovered from COVID-19 infection. Out of 1,38,000 inpatient tested for COVID-19 in 2020, the total inpatient and the ICU days for COVID-19 patients in 2020 were 52,008 days. Facility setup and purchase of capital assets in response to the pandemic was 65 million, and it accounted for 35.09% in hospital expenditure. Patient care related supplies and services were 65 million and accounted for 35.09% of the in-hospital expenditure. The largest single item category of expenditure include was medical supplies was about 21 million, which accounted for 11.63% of all in-hospital expenditure. And pharmaceutical expenditure was more compared to other in-hospital expenditure, which accounted for about 37.21% of the total expenditure spent. 35,205 COVID-19 test swabs were performed on 19,611 patients admitted to the hospital. Of the 19,611 patients tested for COVID-19, 727, that is about 3.7%, were positive for COVID-19. The median length of hospital stay of COVID-19 patients was 8 days, that is between 6 to 13 days. Of the 727 COVID-19 patients, only 0.4% were admitted to the ICU for a median of 2 days. It is between 1 to 5 days. And patients of age above 40 years were maximum, that is percentage of 70.85%, and below 40 years were 29.14%. And male patients were more compared to female patient. Male patient accounted for 57.03% and female patient accounted for 42.96%. And this table shows the age and gender differences patients affected with COVID-19. Percentage and count number of patients affected has been explained here. Table 1. It shows the total cost incurred in the hospital for the entire year. So we conclude that COVID-19 has led to increase in healthcare expenses and displacement in hospital services Our findings are useful for informing economic evaluation of a COVID-19 response and providing some information about the expected cost of future outbreaks. These are our references. Thank you.
Thank you. We now have the last paper, COVID-19 and its long-term impacts to the quality of life of women garment workers. A case study of the beer gum export processing zone, Sri Lanka. Presented by Dimagi Jabba.
Hello everyone, my name is Dimagi Pitawala and I'm here to present my study, COVID-19 and its long-term impacts to the quality of life of women garment workers, a study of the beer gum export processing zone, Sri Lanka, co-authored by Professor Shyamala Kumar. First of all, I'll give a small background to this topic. The COVID-19 pandemic that originated in Wuhan, China was detected in Sri Lanka by late January 2020. And since then, the Sri Lankan government introduced various measures to curtail the spread of the virus. The pandemic, along with these imposed restrictions, caused unprecedented damage to the Sri Lankan economy, which were observed through several sectors. And among those, the garment industry is one of the highest vulnerably affected sectors. When talking about the garment industry of Sri Lanka, this industry employs around 15% of the country's workforce, and it contributes 4 to 5% to Sri Lanka's GDP, accounting for around 40% of the total exports. This indicates a substantial contribution of this industry to the Sri Lankan economy. The industry also directly and indirectly employs around 300,000 to 600,000 people, out of which 78% is women, and nearly 50% of them are sewing machine operators. When we look at why this issue is important to be studied, the workers employed in garment factories around the world were directly infected with the virus, thereby halting operations within factories. And the workers in the apparel industry experienced a range of conditions ranging from food insecurity, health and safety risks when working in factories that have resumed operations during the pandemic, and also they experienced headcount and salary reductions during the pandemic. In Sri Lanka, the COVID-19 forced lockdown, caused factory shutdowns, and curtailed production, leaving workers with no work and income. And also, these workers suffered extreme anxieties as they could not send money back home to their families, suffering economic hardships during the pandemic. And also, we can see that COVID-19 has far-reaching effects extending beyond the health implications. The researchers are now beginning to discover the long-term consequences of the virus in terms of persistent severe symptoms, organ dysfunction, post-traumatic stress, and even job and economic losses. So this study reflects the long-term impacts of the pandemic on a very vulnerable workforce during the COVID-19 outbreak, who were also in the front line of the outbreak. So our objective was to study the long-term impacts of COVID-19 on the quality of life of women garment workers. So for this, we used 4 quality of life dimensions of the World Health Organization Quality of Life BREF model. So quality of life, as defined by the World Health Organization, is the individual's perceptions of their position in life in the context of the culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. So this is our conceptual model where we analyze the quality of life using 4 dimensions, which were physical, psychological, social, and environmental quality of life. When talking about the methods of this research, the research design was qualitative, which used a telephone survey, and multi-stage cluster sampling was conducted to obtain a sample size of 120. Participants were selected from the study site, which is the beer gum export processing zone, which was one of the highest hit and vulnerable export processing zones during the peak periods of the pandemic in Sri Lanka. The target population was the women garment workers in the beer gum export processing zone, and data was analyzed using thematic content analysis for this study. Let us now move on to the results of this study. When we first look at the long-term impacts of COVID-19 to the environment quality of life of these workers, we can see that the COVID-19 has reflected the fragile nature of the garment industry through previous studies, and also certain studies reflect that factories had to be suddenly closed down in response to the pandemic, and therefore several workers had to be laid off in these export processing zones. But in this study, workers reported that their salaries were largely reduced during the pandemic, and several studies which were conducted in the past indicate that these reduction in salaries range even up to around 5% to 60%, depending on the salary level of the employees. And in addition, these workers, in addition to the reduction of their salaries, they did not receive the overtime hours, incentives, and benefits during the pandemic period as well. These effects were also coupled with the job losses of their family members as experienced by these workers, and also the reduction in their salaries along with the job losses of their family members have caused economic hardships and financial struggles to these workers. But these effects should not be regarded as only short-term consequences, because these could largely have long-term consequences in the future as well. The persistence of the reduction in salaries causing economic hardships and financial struggles could threaten the economic stability of these households, of the workers, and also their future plans and activities could be at risk. And if this situation continues to persist, it could turn into a situation as predicted by the World Bank for Cambodia, that the rural households that are reliant on the garment industry, their poverty rates could even increase by over 20% if their economic hardships continue to persist during the pandemic. And in addition to this impacting the economic situation of the households, these impacts could also have an effect on the psychological state of the family members, thereby causing tension within the families. And if the reduced salaries and the reduction of benefits continue to persist in the long term, it could create social instability as well. And it should be noted that these effects are largely and drastically felt by these workers during the pandemic, because there are no welfare schemes or even unemployment insurance schemes employed by relevant authorities such as the government and the government companies in response to the pandemic to take care of these workers. Let us now look at the long-term impacts of COVID-19 to the physical quality of life of workers. When looking at the COVID-infected cases among the respondents in the Begum Export Processing Zone who participated in this study, we could see that a substantial portion of 18.3% of the workers who participated in this study had been infected with the COVID-19 virus. And when this proportion is compared with the Sri Lankan population who was infected with the virus at the same time, which is only 1.35%, we can see that this amount is very, very high when compared to the Sri Lankan population who was infected with the virus. This indicates that garment workers are a very vulnerable workforce to the COVID-19 virus, and they have been largely affected and directly infected with the COVID-19 virus. Respondents who participated in this study also reported of a range of physical conditions that have been experienced by them even after an year post-infection of the virus. They complained of increased breathlessness, headaches, heavy exhaustion, chest pains, back pains, and fatigue as a result of being infected with the virus. And also it should be noted that there is no post-recovery aftercare services that have been extended to these workers to take care of their physical well-being after being infected with the virus. And these impacts should not be regarded as only short-term occurrences, because these could largely have long-term consequences if proper attention is not paid to take care of these. So the persistence of these symptoms could turn into long COVID conditions, which are long-term effects of the coronavirus, which could lead to organ damage, even post-viral syndrome and post-critical care syndrome if necessary attention is not paid. And also it should be noted that these workers already have physically demanding jobs and have a range of physical conditions that have been arisen as a consequence of their job. And if these conditions persist in the long term, it could further aggravate their physical health conditions, thereby putting their physical health at risk. Looking at the long-term impacts of COVID-19 to the psychological quality of life, the workers who participated in this study reported that they experienced constant fear and anxiety at the workplace, as they are required to work in very crowded factories and even reside in communal residences such as boarding houses and hostels. These workers are already exposed to a very vulnerable and risky environment during the pandemic. Therefore, they experience a fear and anxiety. And also, it has been aggravated by the mental distresses they face due to the family responsibilities during the pandemic. And several of the workers reported how their children have been staying at home due to the closure of schools, and it requires the attention of the mothers who are the working mothers to take care of the education of these children during the pandemic as well. And this has resulted in increased stress of the workers, and also the workers are worried about the family's health as well as the children's education, and also certain job losses of other family members. The workers who have arrived from rural areas to work in export processing zones in urban areas also feel guilt for not being able to care and assist for their families, as reported by workers in this study. As families are left alone in rural areas, these workers fear for the safety, health, and care of these families, which these families can't attend to as they're living away from home. These conditions could also have potential long-term consequences if they are not given the proper attention. So these conditions could have a long-term impact on the psychological well-being of both the workers and of their children. And it is also likely to affect the future career of these women as well. It could also sometimes result in depression if the stresses and the worries continue to persist in the long term. And as these workers face in the front line during the pandemic in a very exposed environment to the COVID-19 pandemic, these workers could face post-traumatic stress as well. Let us now look at the long-term impacts of COVID-19 to the social quality of life of workers. Workers in this study reported how they feel isolated at work. Due to the social distancing measures employed at the workplace, these workers are prevented from talking with each other or even eating together during lunch, which they used to practice before the pandemic. And also these workers reported how they are isolated from their friends and even from their family. These workers deliberately distance themselves from their family members due to the risk of infection that these workers carry, and they want to protect their loved ones. And also they have been distanced from their friends due to the inability to participate in social gatherings, which were socializing activities for these workers before the pandemic. And this has resulted in the lack of social support and intimacy at a much needed time for these workers. And also workers reported of another aspect of the social quality of life that has been affected by the pandemic, which is the discrimination and hostile behavior these workers face from the society. As these workers work every day in a very vulnerable and exposed environments to the COVID-19 outbreak, the general society tend to view these workers as carriers of the virus. And several workers reported how their family, their neighbors, and even their relatives ignore them, treat them, bully them, in even using verbal harassments by treating them as carriers of the virus. And also they are afraid and fearful that they could get infected through these workers. And these impacts should also not be regarded as short-term consequences, as they could have long-term implications for these workers as well. So the persistence of the distancing from the friends, colleagues, and the family could result in the disruption of close bonds, relationships, and the social support of these workers. It could also result in the loss of closeness among family members. And the continued isolation is likely to cause cognitive decline if it persists in the long term as well. And it should also be noted that the continued discrimination could fuel the stigmatization, discrimination, and marginalization of workers who are already marginalized in economic and social spaces in Sri Lanka. So in conclusion, the COVID-19 pandemic has likely implications on the environmental, physical, psychological, and social quality of life of women garment workers for the long term. Government companies and the government must therefore identify the potential consequences of the pandemic and develop necessary policies to curtail the negative effects. Some of these policies could be to conduct health campaigns, regular health monitoring programs, monitoring the psychological and the social needs of the workers post-pandemic, strengthening the counseling services, and protecting workers through social safety nets during crisis. This is the end of my presentation. Thank you.
Thank you. We now have short time for questions. We have two questions. First one is to, all right, Marina Shestra. I think she has already replied. Priyan, would you like to take it with Ms. Shestra, or are you okay with the reply that she has given?
I don't know if she likes to elaborate. We can hear.
Yeah,
her.
I think Marina, would you like to elaborate on what you have indicated here?
Yes, yes, I'm here. Well, I think that so far as I have done in community, so I think that now the people are aware of their health, and from the example of this time lockdown, I think the government is also aware of the communities and the people's health, because comparison to previous lockdown, this time we had on sudden a huge number of the COVID patients this time, and the prevalence was very high in different parts of our country. But despite of all this, the government didn't try to lock down as in the previous years. And there was like alternative days for the work. And of course, the vehicles also, they made the vehicles to run in odd and the even numbers, so that people can work and people can move around and do their general activity, not like in the previous years. So when I conducted my study during the lockdown period, at that time it was totally locked down. So government said that no one could come out of their house. They should totally lock down, and there were certain periods when people could come out of their houses to buy groceries, vegetables, right, and for their emergency things they need to do. So comparing all these from the previous lockdown period and this year, I think the government is also aware, and the peoples are also aware. They started to do morning walk, jogging, their physical exercise little bit, which we can see nearby and around us. So that's all from my side.
Thank you. Priyan, you have a question to Dimag.
Yeah, so actually that question, in a sense, is a question pertaining to our whole webinar. The thing is, how do we extrapolate long-term effects from current observations, right? So I noticed that, you know, whenever she has put down long-term effects, she has quoted from the literature. So
yes,
that's good, right?
Yes.
So, but that's a question really. I mean, we have a set of current observations, right? How can we say, I mean, from a scientific research point of view, right? I mean, not just, I mean, we can just think of these things ourselves, you know, but from a scholarly point of view, how can we extrapolate what we observe now into the future? I don't know whether she would like to answer that.
And also, I would like to add a supplementary in terms of the findings through the surveys and so on. Did you make any observations or recommendations to the garment factories themselves for them to change their way of working or the other practices?
Tudor also has his hand up. I don't know whether he wants to ask a question later or add his question to our.
I didn't see that. Oh yes, Tudor. Yeah. Okay.
Can I ask it?
I think let Dimagi answer the two questions.
Okay. Right.
So Professor Priyan, yes, thank you very much for the question. So yes, sir, I even I compared with the studies that have been conducted during the COVID-19. Hello again.
Yeah, we can hear you.
Yeah, I use studies that have been conducted during the COVID-19 pandemic period as well that predict the consequences of the pandemic for such as the long COVID conditions that could occur. So actually, the study does need to be conducted even in the future to really observe the long-term impacts, like even the post after the pandemic period as well. But I use the studies that have been conducted to compare the studies to understand the consequences that could potentially occur. So for Professor Ranjit Mahindapala's question, yes, there are some recommendations for government companies as well, because during the pandemic period, the companies haven't, even during the early stages, the companies have provided good healthcare facilities for the workers, but with the widespread of the outbreak, the companies have started to lose the attention that they have extended to these workers during the early stages. So it is required, and even the pandemic virus aftercare services, healthcare services for these workers have to be extended, which has not been employed by the garment factories right now. And also the counseling services for these workers should be strengthened during the pandemic period, because they are facing a very vulnerable time and a very hard time during work. So
thank you. I just noticed that your paper is with Dr. Kumar.
Yes.
Is she online or no?
Not today, sir.
All right.
Yes.
Tudor, the question is to who?
To Dimagi also.
Okay, all right.
Let me first say that I really enjoyed your presentation because it covers many different aspects of garment workers. And also, you know, in spite of all the COVID-related problems, garment industry continued throughout the pandemic. I think that's one of the industries, you know, which decided no matter what, you know, they will continue the industry. So maybe that is reflected in you know, these outcomes that you mentioned. One thing I want to check with you is now this industry has both male workers and female workers, right? I wonder whether you covered both groups, because, you know, one thing that perhaps needs to be explored further is what are the gender dimensions of, you know, most of the garment workers being female. I just want to check whether you explored that or whether you deliberately excluded.
Yes, I did not include the male garment workers. I only conducted the study for women garment workers because of several reasons. Because the majority of the garment population is women garment workers, and they experience a lot of issues that are really unique to these women. Because even during the pandemic and even before, they face discriminations from the society. And also during the pandemic, their care work, they had a lot of burden at home to take care of the children's education. And these experiences were unique from the male workers. So that is why I only conducted the study for the women garment workers.
But I would say just because of the very reason you mentioned, it would have been useful to compare both male and female experiences, even though male workers were a minority, you know, still, I mean, they were in the garment industry and they were exposed to the same vulnerable conditions, but nevertheless, maybe stigmatization was low. So you can bring it out only if you have a small male sample in your study group.
Okay. Thank you very much, sir.
Thank you. Thank you, Dimagi. We have the last question at Trilecia. The question is that is there any evidence of increased blood collection in the home, from the homes? Is Trilecia around?
Yes, sir, I am around.
Yes.
Your question is any hopes of the improved blood collection with the implementation we have done? Yeah, exactly. I have shown it with figures also, and the island-wide also we have.
No, the question is whether the improvement is found in the current situation after COVID. I mean, in this situation where COVID is somewhat under control.
Yes, sir, exactly, sir. With the first, second waves, it was really burdened because our collection is mainly from the community. Community-based means we are going to their villages, with their offices, their temples, or any social communities, and we collect them. But now, actually, because of that, the relaxation of all the rules, regulations, public gathering is now no more happening, and then restrictions are a little bit better. So with the health precautions, we even go to their places and we collect blood. Plus, in our case, as we have motivated the more in-house donations, now people have get used to the practice of coming to the facility and donating. That would be a real advantage to the government as well, because of the expenditure is lesser than when we go to their places and stay in 4 hours, nearly 6 hours with the air-conditioned vehicles and with all the facilities. So we have our own facilities at there. It's good for the donors as well as staff. In the pandemic situation, actually, it's really benefited. Anyway, so we have seen improvement, better improvement with all the implementations.
Thank you very much. That brings us to the end of the session, and I take this opportunity to thank all the speakers, the Shrestras from Nepal, Lata from India, and Trilecia Vithanavasam and Dimagi Pittivella from Sri Lanka. Thank you so much and have a good day. And I now hand over the proceedings to Professor Das.
Right, thank you. So this is the last mile, right? This is the last session that we have. A very important session because we want to sum up everything that has gone before. So the person who is going to sum this up is Professor C.M. Madhuma Bandara. And I think if you were there in the opening session, I sort of indicated that it was his idea that started off this entire webinar, this theme of the webinar, long-term social impacts of the COVID pandemic. I should introduce Professor Madhuma Bandara also, educated at the University of Peradeniya and University of Cambridge, from which he obtained a PhD in fluvial geomorphology. He is now an emeritus professor at the University of Peradeniya, where he served for over 40 years which included 3 years as Vice Chancellor. He has been chairman of the Presidential Land Commission, of the Interim National Water Resources Authority, of the Academic Board of the National Institute of Education, and of the National Environmental Council. He has made significant contributions to developing the concept of tank cascade system. So he's actually a geographer in the formation of the first National Environmental Action Plan. In particular, he is well known for his proposal for the redemarcation of the provinces of Sri Lanka based on river basin watersheds. He has over 100 research papers and publications to his credit, but he will now sum up on a subject that's a bit different from his expertise, but nevertheless the subject of this webinar. Professor Madhuma Banda.
Thank you, sir, for those words of generosity. Thank you again for inviting me to do this summing up to both the chair and the president. I am grateful. Well, as the president said, we have reached the end of this workshop or webinar. So it's a web conference really. And before we forget everything about this conference, let us put down certain ideas, certain messages to the rest of the world. This is the intention of my taking over. Now, shall I go to the screen?
Yes, you can start sharing your screen.
Okay. Can you all see the screen?
Yes, yes, we can.
Okay. Okay. So what I'm going to do is to summarize and give an idea of the outcomes and opportunities and certain statements made by our presenters. In doing so, let me say that we have started this webinar on a very special day. That is what you call a palindrome. Whichever you count these numbers, they come to the same thing. Well, let me proceed to save time to discuss certain matters which are of importance. But for the purpose of record, I thought I should leave our footsteps or how we came to this conference and how we finish it today. You may be able to read it leisurely, but let me pass through. And we had some very important and interesting keynote speakers. I think they formed the mainstream and the cream of this whole conference. Of course, the young people got some training of how they present things, but these are the minds behind our effort. I need not read them, both local and others. Then looking at the participants or the audience, I was surprised to see some 419 participants from 32 different countries. And that's a fairly a good collection. But anyway, these numbers fluctuated, and say they have been between 50 and 100. Then, of course, I got some feedback from the question and answer sessions and the chat box, and of course, directly verbally present in their comments. This gives some idea about the distribution of our participants. This 419 odd as I counted. I must thank Professor Priyan for sending this to me. Maybe there are certain corrections here and there. But out of this, only about 50 to 100 have been the stable participants. Then the process followed here is I didn't want to, summarize every section and every discussion that took place, but picked up a few strands of thought to the best of my ability. And then, of course, did not mention any names of authors or presentations or anything, but some ideas were captured from the question and answer sessions, but no claim is made here for giving a comprehensive summary of all what has happened. I have been very selective, but you are at liberty to make any corrections or add anything missing. Then let me start with some general statements. These are the things that go to the outside world. I think this first sentence saying that, these long-term impacts are much more wide-ranging and deep and enduring. I'm picking up these words from some of our keynote speakers. Then it has also been highlighted that science-based political leadership is critically important. This may be there is some sensitivity, but let us say what we believe is right. Then also there had been some advice given by many speakers that all countries need to reflect on how they govern, finance, and provide public health functions, and so on and so on. Then also there had been certain sentiments expressed about the capacity of the governments and scientists, then how to manage it. But at the same time, there are lessons to be learned to build it better. Then in one of the presentations said that COVID may not be the last pandemic of the 21st century. We can assume that future endemics may not be substantially the same, I think, severe and same. Then the impact on social institutions, I think it is summarized here in a few bullets, and I'll just take the last one only. The cost burden of the COVID as an externality. I think this was an unexpected situation. So for every government, there was a huge burden regarding the cost. The overall impact of the pandemic has been estimated in the order of about 82 trillion over a 5-year time frame. That gives an idea about the magnitude of the whole thing. Among the other outcomes, let me say that there was the opinion that the COVID-19 emerged from viruses in wild animals, particularly bats. But the background to that is largely man-made. In this regard, there was a little discussion, and it was noted that there are lingering public concerns as to whether COVID was a natural or a man-made virus, and what kind of political implications would be there. Then the differences in the ability of countries to respond is glaring. In the developing low-income countries, for example, the vaccine coverage was about 11%, whereas the more developed countries, it is 78%. So that gives an idea of the disparity. Then, of course, the universal social protection systems were mentioned by one of the key speakers from India. And I think that was very well taken. Then continuing, the kind of information revealed before our conference, WHO confirmed cases. If you take 376 million and 5.2 million deaths, But many people believe that the real death toll may be much over 15 million. I do not know, and I don't think we can take this up for discussion. 3 times difference. Okay, then regarding the global health policy and the humanitarian responses, religion has apparently played, according to one of the presenters, in the well-being of the majority of poor in the global south. People are still religious and so on. Then in general, when you come to education, one of the speakers mentioned that of the 1.6 billion students, or 91% of the total, in 188 countries, they were out of school. The only consolation was that the children did not get the full brunt of it. Whereas the elderly people have been the victims of death and so on. Then that's about the impact. Then the emerging opportunities. I think the history amply reminds us that upheavals can be catalysts. Like the phoenix, they can rise from the ashes of destruction, just as like the Second World War. And in this pandemic, also there are certain silver lines, even in the most fragile areas like Kashmir, to which we have listened. Then health system capacity came under great stress and challenge. Then also COVID provided opportunities to reconceptualize health systems, not only health system, but even the education system and so on. Then COVID also provided us with the teaching opportunity of the urgent need to confront the even greater challenges like climate change and so on. Then there appears to be winners and losers in the pandemic. I myself raised this at one stage from Dame Mills. Then the losers, the losing side, we had a lot of emphasis in the conference. That is the poor and deprived groups. But then the other side of the story, the rich people, there had been media reports that some people have become billionaires due to the increased sales in vaccines and things of that sort. Then it was revealed that advance alerts of impending disasters were in a way given, like this contagion film, and then of course the Dr. Fauci in the US and so on. But the governments and the leaders in general hardly heeded them. So there are opportunities to develop common modalities for providing advice by learned groups of persons in each country. In fact, as an institution, we too discussed the possibility even before the conference. Then global health and humanitarian policies, they have been again in the global south, where things are not the same as in the developed areas. But organizations like the WHO, who have done a wonderful job in this whole episode, they look at very directly from highly scientific and modern angles, which may not be sufficient to handle and manage things at the third world level. Okay, then going through this again for research, I think there is a whole world of opportunity opening up regarding health questions, regarding economic questions, and regarding sociological questions and so on. Then let me go through fast on this. Then there was one paper on foresight analysis. I thought that's a very unique one. And for me, of course, that is what I anticipated as in this conference, because see, the thing is that whatever the advancements in science, science could not predict what was coming up, at least to give a few weeks notice. It all erupted. And nor can we predict through science when will be the next one coming. There are ways of handling this. That one way is the foresight analysis, and this lady who presented it, she did it very well, and we must congratulate her for that. Then continuing, coming to Sri Lanka, I think some studies were reported here, but our economy is largely in the service sector. So service sector was one of the worst to take the brunt of the COVID pandemic. Education was one of the worst affected, and there were paper after paper in the education sector showing what happened to the children. But one thing very serious came up from, I think, one of the foreign presenters, Akers, I think. I may not be right, please. He brought up this whole issue of the lost generation, which struck me very much. We'll come back to that. Then regarding the way forward, I think our sponsors as well as the participants expect us to give some at least give some directions for future thinking. And some of them I listed here, not many. One is that the democratic institutions can be eroded by COVID-19. And how can we prevent authoritarianism in the face of these calamities, pandemics, and so on? Although it was not mentioned in our discussions, our country cannot be different. The army had to take over many things. It has not been mentioned anywhere. But people thought that that is the only option available. Otherwise, unruly elements, they will not allow things which are done for the public good. Then also I saw that laboratory and medical scientists, I think they have come together in decision making, but unfortunately in the integration of social sciences, it was not equally seen. So regarding the foresight analysis, I think we have got it. And as I mentioned earlier, this lost generation actually begins to haunt in our minds. Who are the lost generation? The people who have their education disrupted and lived in fear and uncertainty, under stress. When these people grow up, will there be a society of highly individualized characters and keeping social distances and so on and so forth, particularly from the schools? I think this is what I meant by the lost generation. I asked a question also from this person. Then also at one point there came the idea of a global commission for which I contributed. And this is because there are so many aspects of this whole issue. There are so many injustices that have taken place. And WHO has done some studies and they have given the lead to even foresight analysis. But then the WHO as a health organization, it has its own scope limitations. So therefore, some world organization, possibly from the UN, must look at the whole episode of the COVID, at least for the future record. Then recovery is already taking place, and it can, lead to a lot of change. But I think the present generation must seize the moment and the opportunity. Well, I think that's in summary form what I presented. I am sure that there may be other ideas which have come. So please add and make this richer.
Yeah, if you want.
One document for the rest of the world. Thank you very much again.
Thank you. Thank you, Professor Madhuma Bandara, for a very comprehensive summary made almost in real time, because you had to do it while the webinar was going on. But we will need to create some kind of document of this nature, like he said, and then we would like to get other views also, so that it is a consensus document. So as an academy, we have not decided whether to send it to all the participants or only the panelists, but we will make some decisions like that and circulate, certainly at least to some, if not all of you. So please watch out for that, and please try to contribute in whatever way you can, because building consensus also is a very important feature of this whole thing. I don't know whether anybody wants to make one or two quick responses. I know it's the end of 3 long days, but any responses to what Professor Madhuma Bandara said, make some additions or emphasize some things that he said. I can leave it open for a few minutes. Please unmute yourself and speak. You don't have to, because there aren't many of us.
Priyan, how many minutes you have?
I think we want to bring it to a close now. So
is it at 7 o'clock?
Yes. We would like to finish by in another 15 minutes at most. But certainly, I mean, we can go on a little bit after that also if there is good participation. But is there anyone who would like to comment? Tudor, of course, is a sociologist, so I can ask him to comment if no one else is saying anything.
Why not? Yeah.
Well, I fully support what Professor Madhuma Bandara presented. I also want to add a couple of other things. One thing that came out, particularly from the UN resident representative, is the role of social sciences. I think she stressed on 2 or 3 separate occasions that social sciences have to play an important role, both in terms of doing research, but also in terms of collaborating with other kind of specialists, because there is definitely a behavioral and human dimension which needs to be addressed satisfactorily. So we should probably try to highlight it. I think 2 or 3 people mentioned that. Even one of the other, Vivian, also referred to the potential role of social science. So maybe we need to unpack it a little bit and also see how we can take it forward, in terms of research and interventions.
And then expertise, yes.
That's
sociologists, maybe
not only sociologists. I think they all psychology,
right,
economists, geography.
And even philosophers, perhaps, right? I mean, because in a sense, we need to learn how to live life. Philosophers are people who tell us, how then shall we live? I mean, it's not only science that has a say on that. Yes. Any others?
In fact, Priyan, may I add something?
Yes.
In one of the comments I have displayed earlier, there was actually a kind of accusation for social sciences, saying that at the peak of the activity, medical and other scientists have come together, but not the social sciences.
Yes.
So that was there, but what Tude is saying is not highlighted enough, and we can accommodate that.
Yes. All right. So anybody else wants to say anything? Because otherwise I'm going to close it.
Maybe tired at the end of a
yes.
journey.
So please,
perhaps as you suggested, we can take this up at the council, because now it is our baby.
Yes, of course.
The conference is organized by us, and we can summarize in the way we think it is best before sending it out.
Yes, certainly. Ranjit, did you want to say something?
No, I think I would agree. I agree with Professor Madhum Bandara's point. Yeah, let's move ahead on that.
Right. Okay, so just for, there aren't many participants there, but apart from this consensus statement, many of you have asked about the recordings of this and, the presentations. So those things, certainly with the permission of the presenters, we will circulate those. And we are also trying to produce, at least for some of the presentation, 5-minute video clips. It's a sort of a new expertise that we are trying to develop. So we will see whether we can do that, and then all 400 of you who registered, perhaps we will get these or get the YouTube links to these, and we will see whether we can, have a little bit more traction on the dissemination. Right. So before I close, I thought I need to thank some people. So I didn't want to get a separate person to do the vote of thanks, because right through this webinar, we have done this in a very informal way. So I'm going to read out a list. And first of all, I'm going to apologize for anyone who has been left out of this list. So here goes. I will start with people who did things behind the scenes, right? So right in this room, there is Erandi Narangoda and Shamira Randil, who are the webinar organizers. Sama Jayasekara works in our office at the academy, and she made a few contributions as well. Then I am sitting in the office of the International Institute of Knowledge Management, who are our webinar hosts. So Duminda Koralagamage, who is the main person there, Lakshika Abhikon, who is, I think, the event manager or head of events. So they supported us, and in fact, they hosted us also, because it is from this small room that this entire international webinar has been taking place. So I want to thank them for their hospitality and their expertise and their competence in putting this together. Then, of course, every Monday afternoon, there was a planning committee meeting with about 6 or 7 people. This included the chairs who you experienced during the webinar, Professor Tuda Silva, Professor Nadira Karnavira, and Dr. Ranjit Mahindapala, and a few others also from the Academy Council. And like I said, I need to acknowledge a special thanks to Professor Madhuma Bandara, who actually gave us this idea about the topic. Then, if I expand out this circle a bit more, the Council of the National Academy of Sciences of Sri Lanka, other fellows who contributed in small ways, and then we go to our parent body, the Association of Academies and Societies of Science in Asia. So it is a competitive grant, competitive call for proposals that we responded to, and they were able to fund us for this. I think the funding eventually came from what is called the Inter-Academy Partnership, that is sort of the global organization. So we want to thank them for having faith in us, and hopefully they will appreciate what we have done. So there are other agencies also who help in the publicity. Special mention I would make of the Indian Council for Social Science Research, the UK Academy of Medical Sciences, the UN system starting from the resident representative office here, and the National Science Foundation, from which we got a lot of publicity in Sri Lanka. Then we had an audience, potential audience, let us say, of 410 people at least those are the people who registered from 32 countries. So people who listened and sometimes made comments and asked questions. I want to thank the thematic speakers, 25 of them. Maybe all 25 didn't make it to the final stage of recording their presentation, but we sent them some very detailed descriptions and gave them various things to do. So at the end of the day, almost all of them delivered. So thank you very much for bringing many of those case studies, localized case studies. Those were also much appreciated. And then, of course, our keynote and lead speakers, who, as Professor Madhuma Bandara said, provided the real expertise for the webinar. And we had some very insightful presentations from all of them. And we thank them for that. For the people who gave messages, somebody mentioned the UN resident coordinator this morning, and Dr. Palita Bekon yesterday. Then, of course, the acting President Asa on the first day. And in particular, of course, I want to thank, like I said on the first day also, the first thing we did was to try and get, a few key people on whom the success of this thing would depend. So Dominic Abrahams, with whom I made cold contact, we did not know him, but he responded graciously. And of course, Professor Malik Piris, who is known to many of us. So, but of course, he's a very busy person, but he very graciously accepted our invitation. And then we built everyone around them. So, so we need to thank all of these people. I think I should make special mention of Professor Tudor Silva, who was also responsible for getting many of the keynote and lead speakers, and also Dr. Ranjit Mahindapal. So I hope I have not missed anyone out. Thank you for everything that you have done to make this webinar. Hopefully the success it is. Its success, of course, will depend on the follow-up work that we do, but at least we have listened to various voices, exchanged views, and maybe got some insights. So thank you very much.
And somebody has raised his hand, I think. Raj.
Rajdeep Jha. Okay, right. You are going to have the last word, right? Okay. Please go ahead then.
Hello, good evening, sir.
Yes.
Yeah, sir. Just a few words to add, sir. But you were telling that actually I am from a social science background, and this whole seminar, this whole webinar was projected by a National Science Academy. But the few words was what Tudor Silva sir told, that there should be, and we all agreed, sir, that there should be a collaboration between social scientists and people from science background. The whole thing is about the justice, but what kind of justice would be there, whether there is distributive justice or not. So just a few lines that there should not be something which is based on utilitarianism. That is maximum happiness of the greatest steps of the greatest number. The thing is that there should be justice should be based on Rawlsian notion of justice. That is, whether it is to the benefit of the least advantaged or not. I am from a country of Gandhi. So that is the thing, that we should be focusing on the least advantaged people, that is poorest of the poorest. So if, and in this COVID time, we all see that how the COVID has made the things more vulnerable for the poor sections, and the class divide has become more starker. So every approach should be said in this way, that there should be collaboration between different social scientists, and people from all backgrounds, so that in the near future, in the future we can tackle this kind of pandemic or any crisis in a better way. That is all, sir, and thank you very much, all, sir, for giving me this opportunity to present my paper. Thank you, sir.
Yes, thank you very much. I was muted a little while ago. Thank you for reminding us about this very important dimension of justice. Very, very important. I must say that our academy, although we call it the National Academy of Sciences, it includes social scientists. But of course, social scientists are rather underrepresented in our academy. So I'm not sure how it is in different academies. In the UK, for example, I mean, there are different academies for medical sciences. Now, Professor Dominic Abrahams was from the British Academy, which is for the social and for the social sciences. The science activities are looked after by the Royal Society. But your call is really not so much for natural scientists or social scientists, but for whoever we are. I think we need to think about, this Rawlsian principle, and also enunciated earlier by Karl Popper about the least suffering for the most marginalized. Yes, so that's a very good note on which to stop. Thank you very much. I wish you all of you all the best, and maybe it is late enough for any part in the world to say good night now. Okay, so thank you very much. But we have all your emails, and we will probably be corresponding with you. So keep in touch. Yes. Okay.
Thank you.
Thank you very much.